ವ್ಯಾಂಪೈರ್ ಫೇಶಿಯಲ್ ಅಂದರೆ ಪ್ರೈಮರಿಲಿ ಅದರಲ್ಲಿ ಏನು ಮಾಡ್ತೀವಿ ಅಂದರೆ ವಿ ಎಕ್ಸ್ಟ್ರಾಕ್ಟ್ ಪೆರಿಫರಲ್ ಬ್ಲಡ್, ಅದರಲ್ಲಿ ಪ್ಲೇಟ್ಲೆಟ್ಸನ್ನು ಸೆಪ್ರೇಟ್ ಮಾಡಿ ಒಂದು PRP ಥರ.
What are your thoughts on the facials which is happening at home wherein people are taking steam, ಮತ್ತೆ ಏನೋ ಒಂದು ಫೇಸ್ ಪ್ಯಾಕ್ ಹಾಕೊಂತಾರೆ? What is the reality of both the worlds?
So diet is the key. Add-ons can come at different phases in your life. Korea is definitely the numero uno in Asia. And of course, world allo, just like their cars and televisions, they have a prime place. But yenagide andre humans iga we eat for recreation, not for other things. All the melanin that our skin has, and which we all love to hate mostly, protects us from UV damage.
Today on Just Curious, it is one and only Dr. Shetty, leading dermatologist, celebrity dermatologist of Bangalore, hagene aesthetic laser physician. Sir, hegidiri?
Nan chanagidini. Thank you for the invite. Happy to be here.
Pleasure is mine. So ನಾನು ನಿಮ್ಮನ್ನು ಕ್ಯಾಮ್ರಾ ಮುಂದೆ ಅಥವಾ ನನ್ನ ಶೋನಲ್ಲಿ ಮಾತಾಡ್ಸೋಕ್ಕೂ ಮುಂಚೆ ಫಸ್ಟ್ ಐ ಆಮ್ ಯುವರ್ ಪೇಷಂಟ್. I think in 2015 or 16 I remember ಹೆಂಗೆ ಅಡಲ್ಟ್ ಆಕ್ನೆ ಸಡನ್ಲಿ ಜಸ್ಟ್ ಕೇಮ್ ಆಲ್ ಓವರ್ ಮೈ ಫೇಸ್. ಅಲ್ಲಿವರೆಗೂ ನೈಸ್ ರೋಡ್ ಥರ ಇದ್ದಿದ್ದು ನನ್ನ ಫೇಸು ಸಡನ್ನಾಗಿ ಬೆಂಗಳೂರಿನ ನಾರ್ಮಲ್ ರೋಡ್ ಥರ ಆಗಿ, ಐ ಥಿಂಕ್ ಆ್ಯಕ್ಟರ್ ಸುದೀಪ್ ಅವರ ವೈಫ್ ಪ್ರಿಯಾ ಸುದೀಪ್, ಶೀ ಈಸ್ ದ ಒನ್ ಹೂ ರೆಫರ್ಡ್ ಮೀ ಟು ಯು. ಆ್ಯಂಡ್ ಎವರ್ ಸಿನ್ಸ್ ದೆನ್ ನಂದು ಹಿಂಗಂದರೆ ಡರ್ಮಟಾಲಜಿ ಅಂತ ಬಂದಾಗ ಇಟ್ಸ್ ಲೈಕ್ ಹೌ ಯು ಡೋಂಟ್ ಚೇಂಜ್ ಹ್ಯಾಂಡ್ ಸೋ ಆಫನ್ ಅಲ್ಲ, ಅವತ್ತಿಂದ ದ ಟ್ರಸ್ಟ್ ಹ್ಯಾಸ್ ಬಿನ್ ದೇ. ಆ್ಯಂಡ್ ಹೆನ್ಸ್ ಸಿನ್ಸ್ ಐ ಆಮ್ ಯುವರ್ ಪೇಷಂಟ್ ಆ್ಯಂಡ್ ನೆಕ್ಸ್ಟ್ ದ ಹೋಸ್ಟ್, ಯು ಆರ್ ಹಿಯರ್ ಟುಡೇ. ಹೇಗಿದ್ದೀರಾ ಡಾಕ್ಟರ್? ಆ್ಯಂಡ್ how has your day been so far?
Being a Saturday, ಸ್ವಲ್ಪ ಬ್ಯುಸಿ ಆಗಿತ್ತು. ಆ್ಯಂಡ್ ಇದು ನಡೀತಾನೆ ಇರುತ್ತೆ. ನಿಮ್ಮ ಡೈಲಿ ಸ್ಕೆಡ್ಯೂಲ್ ಹೇಗಿರುತ್ತೆ ಅದೇ ಥರ ನಮ್ಮದು.
ನಾವು ಮೈ ಕ್ಯಾಮ್ರಾ ಮುಂದೆ ಆಟ ಆಡ್ತಿರ್ತೀವಿ, ನೀವು ಅದ್ರ ಮುಂದೆ ಆಟ ಆಡೋರ ಜೊತೆಗೆ ನೀವು ಆಟ ಆಡ್ತಾ ಇರ್ತೀರಾ. ಫೇಸ್ ಅಂತೆ, ಲೇಸರ್ ಏನೋ ಥೆರಪಿ, ಸೋ ಮೆನಿ ಇದೆಲ್ಲ.
ಹೌದು.
ಸೊ ವಾಟ್ಸ್ ಯುವರ್ ರುಟೀನ್ ಲೈಕ್? ಅಂದರೆ ಡಾಕ್ಟರನ್ನ ಸೈಡಿಗಿಟ್ರೆ ಮಿಸ್ಟರ್ ಶೆಟ್ಟಿ, MK ಶೆಟ್ಟಿ ಅವರು, ಐ ಮೀನ್ ಆ್ಯಸ್ ಅ ಡರ್ಮಟಾಲಜಿಸ್ಟ್ ಆ್ಯಂಡ್ ದೆನ್ ದ ಪ್ರೊಫೆಷನ್ ದಟ್ ಯು ಆರ್ ಇನ್, ನಿಮ್ಮ ಹ್ಯಾಬಿಟ್ಸ್ ಹೇಗೆ? ಬೆಳಗ್ಗೆ ಅದು ರುಟೀನ್ ಅಂತೆಲ್ಲ.
ನಮ್ಮದು ಬೆಳಗ್ಗೆ ಇಟ್ಸ್ ರೆಗ್ಯುಲರ್ ಒಂದು 7 o'clock up in the morning, a little bit of exercise, quick breakfast, ಮತ್ತು ಕ್ಲಿನಿಕ್ಕಿಗೆ. ಸೊ ಕ್ಲಿನಿಕ್ ನಮ್ದು ಏನಾಗುತ್ತೆ ಅಂದರೆ ಮೋಸ್ಟ್ ಪ್ರೊಫೆಷನಲ್ಸ್, ವೆದರ್ ಇಟ್ಸ್ ಹಾಸ್ಪಿಟಲ್ ಪ್ರೈವೇಟ್ ಕ್ಲಿನಿಕ್ ಪ್ರಾಕ್ಟೀಸ್, ಇಡೀ ದಿನ ಅಲ್ಲೇ ಹೊರಟೋಗುತ್ತೆ. ಮಧ್ಯದಲ್ಲಿ ಏನಾದರೂ ಟೈಮ್ ಇದ್ದರೆ ಲಂಚ್ ಹ್ಯಾಪನ್ಸ್, ಇಲ್ಲ ಅಂದರೆ ಅದು ಇರಲ್ಲ. And then the day winds down around 8 o'clock. It comes to an end.
So first time I remember when I came, it's like jana, all sorts. So before I take ನಮ್ಮ audience into your clinic, ನಿಮ್ಮ routine ಬಗ್ಗೆ ಎಲ್ಲ ಶುರು ಮಾಡಿದ್ರಿ. So let me tell ನಮ್ಮ audience, this is a clinic 2000 ಶುರು ಆಗಿದಲ್ವಾ, in the year 2000. So far 24 years, and then firstly ಇವತ್ತಿಂದು 2024ನ ಲೇಟೆಸ್ಟ್ ಇನೋವೇಷನ್ ಏನು ಡಾಕ್ಟರ್ ಡರ್ಮಟಾಲಜಿ ಅಂತ ಬಂದ ತಕ್ಷಣ?
ಈಗ ಈ 24 ಇಯರ್ಸಲ್ಲಿ ಏನಾಗಿದೆ ಅಂದರೆ, ಡರ್ಮಟಾಲಜಿ ಮೊದಲು ಒಂದು 2 decades ago ಸ್ಕಿನ್ ಡಿಸಾರ್ಡರ್ಸ್ ಮಾತ್ರ ನಾವು ಟ್ರೀಟ್ ಮಾಡ್ತಾ ಇದ್ದಿದ್ದು. ಆವಾಗ ಒಂದು ಡೆಕೇಡ್ ಆದಮೇಲೆ ಈ ಎಸ್ಥೆಟಿಕ್ಸ್ ಅಂತ ಒಂದು ಕಾನ್ಸೆಪ್ಟ್ ಹೋಲ್ ತಗೊಂಡಿದೆ. ಆ್ಯಂಡ್ 2024ಗೆ ಬಂದವಾಗ ಎಸ್ಥೆಟಿಕ್ಸ್ ಡರ್ಮಟಾಲಜಿ, ಮೇನ್ ಸ್ಟ್ರೀಮ್ ಡರ್ಮಟಾಲಜಿನೂ ದಾಟಿ ಫ್ರಂಟ್ ರೋ ಆಕ್ಯುಪೈ ಮಾಡಿದೆ ಈಗ. ಸೊ ಡಿಸಾರ್ಡರ್ಸ್ ಹೌದು, ಅದು ಇದ್ದಿದ್ದು ಇರುತ್ತೆ, ಕಂಟಿನ್ಯೂ ಆಗುತ್ತೆ. ಬಟ್ ಈ ನೀವು ಬಸ್ ಅಂತ ಈ ವರ್ಡ್ ಯೂಸ್ ಮಾಡ್ತಿರಲ್ಲ, ಇಟ್ ಈಸ್ ಆಲ್ ಅರೌಂಡ್ ಎಸ್ಥೆಟಿಕ್ಸ್.
ಸೊ ಫಾರ್ ಅಂಡರ್ಸ್ಟ್ಯಾಂಡಿಂಗ್ ಎಸ್ಥೆಟಿಕ್ಸ್ ಅಂದರೆ ಕ್ಲಿನಿಕಲ್ ಅಡ್ವಾನ್ಸ್ಮೆಂಟ್ಸಿಂದ ಹೌ ಯು ಕ್ಯಾನ್ ಅಡ್ವಾನ್ಸ್ ಅಥವಾ ಇನ್ಕ್ರೀಸ್ ನಿಮ್ಮ ಬ್ಯೂಟಿ ಎಲಿಮೆಂಟ್. ಇಟ್ ಕುಡ್ ಬಿ ಸ್ಕಿನ್ ಲೈಟ್ನಿಂಗ್, ಇಟ್ ಕುಡ್ ಬಿ ಕೆಮಿಕಲ್ ಪೀಲ್ಸ್ ಅಥವಾ ಈ ಥರದೆಲ್ಲ ಅಲ್ವಾ? ಸೊ ಈ ಮೊದಲು ಅಲ್ಲಿವರೆಗೂ ಇದ್ದಿದ್ದು ಕುಡ್ ಬಿ ಆ್ಯಕ್ನೆ ಪ್ರಾಬ್ಲಮ್ ಆಗಿರಲಿ, ಬ್ಲೆಮಿಷಸ್ಸು ಆ್ಯಂಡ್ ಹಾರ್ಮೋನ್ಸನ್ನು ಹ್ಯಾಂಡಲ್ ಮಾಡೋ ಆ ಮೆಡಿಕಲ್ ಪ್ರಿಸ್ಕ್ರಿಪ್ಷನ್ಗೆ, ದಟ್ಸ್ ಆಲ್ ಐ ಥಿಂಕ್ ಇಟ್ ಯೂಸ್ ಟು ಬಿ ಟು ಸಮ್ ಎಕ್ಸ್ಟೆಂಟ್ ಬಿಫೋರ್.
ಸ್ಕಿನ್ ಹೇಗಂದರೆ ನಿಮ್ಗೆ ಗೊತ್ತು, ಇಟ್ ಈಸ್ ದ ಲಾರ್ಜೆಸ್ಟ್ ಆರ್ಗನ್ ಸಿಸ್ಟಮ್. ಅದರಲ್ಲಿ ಇಟ್ ಪ್ಲೇಸ್ ಹೋಸ್ಟ್ ಒಂದು 3,500-4,000 ಡಿಫ್ರೆಂಟ್ ಕಂಡೀಷನ್ಸ್. ಸೊ ನಾವೇನು ಮಾಡ್ತೀವಿ, ನಾವು ನಮ್ಗೆ ಕಾಣಿಸ್ಕೊಳ್ಳೋದು ಸ್ಕಿನ್ ಫೇಸ್ ಮೇಲೆ ಮಾತ್ರ ಮೋಸ್ಟ್ಲಿ, ಆರ್ ಎಕ್ಸ್ಪೋಸ್ಡ್ ಏರಿಯಾಸ್ ಏನಾದರೂ ರ್ಯಾಷಸ್ ಇದ್ದರೆ ಎದ್ದು ಕಾಣಿಸುತ್ತೆ. ಬಟ್ ಸುಮಾರು ಕಂಡೀಷನ್ಸ್ ಇದೆ. ಆ್ಯಂಡ್ ಅದು ಈ ಬೇರೆ ನೀವು ಆರ್ಗನ್ ಸಿಸ್ಟಮ್ಸ್ ತಗೊಂಡ್ರೆ, ಹಾರ್ಟ್, ಲಂಗ್, ಲಿವರ್, ಕಿಡ್ನಿ ಯಾವುದೇ ತಗೊಂಡ್ರು ಒಂದು 350-400 ಅಂಡರ್ 500 ಡಿಸಾರ್ಡರ್ಸ್ ಇರುತ್ತೆ. ಬಟ್ ಸ್ಕಿನ್ ಈಗ ಹೇಳಿದ ಹಾಗೆ ಒಂದು 3,500-4,000 ಅಷ್ಟು, ಅದಕ್ಕಿಂತ ಜಾಸ್ತಿನೇ ಅಂತ ಹೇಳ್ಬೋದು. ಸೊ ಅದು ಕೋರ್ಸ್ ಸ್ಕಿನ್ದು. ಈಗೇನಾಗಿದೆ ಅಂದರೆ ಈ ವೆಲ್ನೆಸ್ ಸ್ವಲ್ಪ ಜಾಸ್ತಿ ಇಂಪಾರ್ಟೆನ್ಸ್ ತಗೊಂಡ ಮೇಲೆ ನಾವು ಈಗ ಏನು ನೋಡ್ತಾ ಇದ್ದೀವಿ ಅಂದರೆ how to look better, how to look your best, whether it's at the workplace or just for your own sake. ಇದೆಲ್ಲ ಈ ಆಟ್ರಿಬ್ಯೂಟ್ಸ್ ಬಂದುಬಿಟ್ಟಿದೆ ಈಗ. ಅದಕ್ಕೆ ಸ್ಕಿನ್ ಇಂಪ್ರೂವ್ಮೆಂಟ್ ಹೇಗೆ, ಹೇರ್ ಇಂಪ್ರೂವ್ಮೆಂಟ್ ಹೇಗೆ, ಏನು ತೊಂದರೆ ಇಲ್ಲ, ಬಟ್ ಹೌ ಡು ಯು ಮೇಕ್ ಇಟ್ ಬೆಟರ್ ಅಂತ.
ಸೊ ವಿತ್ ದ ಲೇಟೆಸ್ಟ್ ಅಡ್ವಾನ್ಸ್ಮೆಂಟ್ ಅಂದರೆ ಇವತ್ತು ಗ್ಲೂಟಾಥಿಯಾನ್ ಇಸ್ ಒನ್ ವಿಚ್ ಇಸ್ ಬೇಸಿಕ್ಲಿ ಅನ್ ಆ್ಯಂಟಿ ಆಕ್ಸಿಡೆಂಟ್ through which they say liver it gives the antioxidant. The byproduct is skin lightening agbodu, athwa you feeling young. Today we see cafes wherein people take these IVs. That is one advancement we are talking about. Ee tarade I am curious to know, and also representing ನಮ್ಮ audience curiosities, 2024 na sadyada latest wellness and to look better, what are people running after?
ನೀವು ಹೇಳಿದ್ದೀಗ IV ಇನ್ಫ್ಯೂಷನ್ಸ್ ಭಾಳ ಪಾಪ್ಯುಲರ್ ಆಗಿದೆ. ಒಂದು 10 years ago ನಾವು ಒಂದು 1 or 2 a month ಮಾಡ್ತಾಯಿತ್ತು. ಈಗ ವಿ ಡೂ ಅ ಫ್ಯೂ ಎವ್ರಿ ಡೇ. ಅಂದರೆ ಬಟ್ ಸಮ್ಟೈಮ್ಸ್ ಏನಾಗುತ್ತೆ ಅಂದರೆ ಆಲ್ ದೀಸ್ ಥೆರಪೀಸ್ ನಾವು ಅದನ್ನು ಒಂದು ಫ್ರಿವಲಸ್ ಮ್ಯಾನರಲ್ಲಿ ಅಡ್ಮಿನಿಸ್ಟರ್ ಮಾಡ್ತೀವಿ. ಲೈಕ್ ಯು ಸೆಡ್, ಇನ್ ಅ ವೆರಿ ಕ್ಯಾಶುವಲ್ ಸೆಟ್ಟಿಂಗ್ ಆ್ಯಂಡ್ ಸೋ ಆನ್, ಬೈ ದ ಪೂಲ್, ಇಂಥದ್ದೆಲ್ಲ ಹೋಮ್ ಇನ್ಫ್ಯೂಷನ್ಸ್ ಆ್ಯಂಡ್ ಸೋ ಆನ್. ಬಟ್ ಸಮ್ಟೈಮ್ಸ್ there could be problems.
Like?
Allergies ಆಗ್ಬೋದು, ರೇರ್ ಆಗಿದ್ದರೂ ಆಗ್ಬೋದು. ಆವಾಗ ನಮಗೆ ಪೂಲ್ ಸೈಡೆಲ್ಲ ಮಾಡ್ತಾ ಕೂತ್ರೆ ಇದಾಗಲ್ಲ. ಸೊ ಐ ಥಿಂಕ್ ಈ ಟ್ರೀಟ್ಮೆಂಟ್ಸ್ ಎಷ್ಟೇ ಪಾಪ್ಯುಲರ್ ಆಗಿದ್ದರೂ ಕರೆಕ್ಟ್ ಸೆಟ್ಟಿಂಗಲ್ಲಿ ಮಾಡಬೇಕು. ಇನ್ ಅ ಕ್ಲಿನಿಕ್ ಆರ್ ಅ ಹಾಸ್ಪಿಟಲ್ ಸೆಟ್ಟಿಂಗ್, ನಾಟ್ ವೆರಿ ಕ್ಯಾಶುವಲಿ ಟೇಕನ್. ಏನೋ ರಾಂಗ್, ನಥಿಂಗ್ ಮೇ ಗೋ ರಾಂಗ್, ಬಟ್ ಯು ನೆವರ್ ನೋ. ಇಟ್ ಶುಡ್ ಬಿ ಮಾನಿಟರ್ಡ್. ಒಂದು. ಸೊ ಅದು IV ಇನ್ಫ್ಯೂಷನ್ಸ್, ಎಸ್, ಇಟ್ ಹ್ಯಾಸ್ ಗೇನ್ ಪಾಪ್ಯುಲಾರಿಟಿ. ಈಗ ಅದು ಬಿಟ್ಟರೆ ಫೇಸ್ ಹ್ಯಾಸ್ ಬೀನ್ ದ ಸೆಂಟರ್ ಆಫ್ ಆಲ್ ಸ್ಕಿನ್ ಥೆರಪೀಸ್. ಆ್ಯಂಡ್ ಪ್ರೈಮರಿಲಿ ನಾವು ಎಸ್ಥೆಟಿಕ್ಸ್ ಅಡ್ರೆಸ್ ಮಾಡಿದವಾಗ ನಾವು ನಮ್ಮ ಅಪ್ರೋಚ್ ಹೇಗಿರುತ್ತಂದರೆ, ಒಂದು there are 4 aspects. ಒಂದು, the envelope, the skin envelope on the face. ಅದರದ್ದು ಟೆಕ್ಸ್ಚರ್ ಹೇಗೆ ಇಂಪ್ರೂವ್ ಮಾಡ್ಬೋದು, ಪಿಗ್ಮೆಂಟೇಷನ್ ಇಶ್ಯೂಸ್ ಇದ್ದರೆ ಹೇಗೆ ಇಂಪ್ರೂವ್ ಮಾಡ್ಬೋದು, ಸ್ಕಾರ್ಸ್ ಇದ್ದರೆ ಹೇಗೆ ಇಂಪ್ರೂವ್ ಮಾಡ್ಬೋದು, ಓಪನ್ ಪೋರ್ಸ್ ಇರಲಿ, ಆ ಥರ. ಸೊ ಟೆಕ್ಸ್ಚರಲ್ ಚೇಂಜಸಲ್ಲಿ ಇದ್ದಾವಾಗ ನಾವು ರೀಸರ್ಫೇಸಿಂಗ್ ಥೆರಪೀಸ್ ರೆಕಮೆಂಡ್ ಮಾಡ್ತೀವಿ. ಲೇಸರ್ ಇರ್ಬೋದು, ಪೀಲ್ಸ್ ಇರ್ಬೋದು, ಆ್ಯಂಡ್ ಸೊ ಆನ್. ನಾವು ಇಫ್ ಯು ಎಂಟರ್ ದ ಸ್ಕಿನ್, ಆವಾಗ ನಾವು ವಿ ಲುಕ್ ಎಟ್ ದಿ ಅದರ್ ಆಸ್ಪೆಕ್ಟ್ಸ್. ಅಂದರೆ ವಾಲ್ಯೂಮ್ ಹೇಗಿದೆ ಅಂತ. ಸಮ್ಟೈಮ್ಸ್ ವಾಲ್ಯೂಮ್ ಡಿಪ್ಲೀಷನ್ ಇರುತ್ತೆ. ಚೀಕ್ಸಲ್ಲಿ ಸ್ವಲ್ಪ ಫ್ಲ್ಯಾಟ್ ಆಗಿರ್ಬೋದು, ಕಣ್ ಕೆಳಗಡೆ, ದ ಲಿಪ್ಸ್ ಮೇ ಬಿ ಥಿನ್, ದ ಚಿನ್ ಮೇ ಬಿ ಸ್ಲೈಟ್ಲಿ ರಿಟ್ರೂಡೆಡ್. ಆವಾಗ ಇದೆಲ್ಲ ಇದ್ದಾವಾಗ ನಾವು ವಾಲ್ಯೂಮ್ ರೀಪ್ಲೇಸ್ಮೆಂಟ್ ಮಾಡ್ಬೋದು ಇನ್ ದ ಫಾರ್ಮ್ ಆಫ್ ಅ ಫಿಲ್ಲರ್. ಮತ್ತು ಕೆಲವರಿಗೆ ಹೈಪರ್ ಡೈನಮಿಕ್ ಲೈನ್ಸ್ ಇರುತ್ತೆ. ಹ್ಯೂಮನ್ ಎಕ್ಸ್ಪ್ರೆಷನ್ನಿಂದ ಈ ಲೈನ್ಸ್ ಬರುತ್ತೆ, ಎಸ್ಪೆಷಲಿ ಇನ್ ದಿ ಅಪ್ಪರ್ ಫೇಸ್. ಆಬ್ಸಲ್ಯೂಟ್ಲಿ, ದ ಫ್ರೌನ್ ಲೈನ್ಸ್, ಫೋರ್ಹೆಡ್ ಲೈನ್ಸ್, ದ ಕ್ರೋಸ್ ಫೀಟ್ ಅಂತ ಹೇಳ್ತೀವಲ್ಲ, ಅದಕ್ಕೆಲ್ಲ ದ ಪಾಪ್ಯುಲರ್ ಟ್ರೀಟ್ಮೆಂಟ್ ಇಸ್ ದ ಯೂಸ್ ಆಫ್ ಬಾಟುಲಿನಮ್ ಟಾಕ್ಸಿನ್. Botox is the best known, the popular brand for these.
It's a brand, is it?
It's a brand.
Just like Xerox tara.
Absolutely. Okay. They were the originators. But there are other brands as well. ಸೊ ಅದಕ್ಕೆ ಬೋಟಾಕ್ಸ್ ಯೂಸ್ ಮಾಡ್ತೀವಿ. ಮತ್ತು ವಿತ್ ಏಜ್ ಏನಾಗುತ್ತೆ ಅಂದರೆ ದ ಸ್ಕಿನ್ ಸ್ಟಾರ್ಟ್ಸ್ ಟು ಸ್ಯಾಗ್, ಲಾಸ್ ಆಫ್ ಎಲಾಸ್ಟಿಸಿಟಿ, ಕಾಲೇಜನ್ ಕಮ್ಮಿ ಆಗಿರುತ್ತೆ. ಆವಾಗ ಸ್ಕಿನ್ ಸ್ಟಾರ್ಟ್ಸ್ ಟು ಕಮ್ ಡೌನ್, ಗ್ರಾವಿಟಿ ಅಸಿಸ್ಟೆಡ್ ಮೂವ್ಮೆಂಟ್ ಟುವರ್ಡ್ಸ್ ದ ಲೋವರ್ ಪಾರ್ಟ್. ಸೊ ಸ್ಕಿನ್ ಟೈಟನಿಂಗ್, ರೀಡ್ರೇಪಿಂಗ್ ಮಾಡ್ತೀವಿ, ಲಿಫ್ಟಿಂಗ್. ಅದಕ್ಕೆ ವಿ ಕುಡ್ ಯೂಸ್ ವೇರಿಯಸ್ ಡಿವೈಸಸ್, ಎನರ್ಜಿ ಬೇಸ್ಡ್ ಡಿವೈಸಸ್ ಅಂತ ನಾವು ಯೂಸ್ ಮಾಡ್ತೀವಿ. ರೇಡಿಯೋ ಫ್ರೀಕ್ವೆನ್ಸಿ ಯೂಸ್ ಮಾಡ್ತೀವಿ, ಅಲ್ಟ್ರಾಸೌಂಡ್ ಯೂಸ್ ಮಾಡ್ತೀವಿ, ಮತ್ತು ಥ್ರೆಡ್ಸು ಯೂಸ್ ಮಾಡ್ಬೋದು ಟು ಫಿಸಿಕಲಿ recontour and lift the skin.
What do you mean re-draping? That's a very draping ಅಂದ್ರೆ ನಮಗೆ ಸಾರಿ.
Correct.
When you said, skin re-draping.
ಹೌದು, ರೀಡ್ರೇಪಿಂಗ್ ಅಂದರೆ ನೋಡಿ, ಸ್ಕಿನ್ ಅಷ್ಟು ಲ್ಯಾಕ್ಸಿಟಿ ಇದ್ದಾವಾಗ ಅಷ್ಟು ಕೆಳಗೆ ಬಂದಿರುತ್ತೆ, ಅದನ್ನು ನಾವು ಲಿಫ್ಟ್ ಮಾಡಿ ವಿ ವಾಂಟ್ ಟು ಪುಷ್ ಇಟ್ ಬ್ಯಾಕ್ ಅಪ್ವರ್ಡ್ಸ್ ಆ್ಯಂಡ್ ಸೈಡ್ವರ್ಡ್ಸ್.
ಸೊ ಈ ಎಲ್ಲ ಸ್ಕಿನ್ ಟ್ರೀಟ್ಮೆಂಟ್ಸ್ದು ಒಂದಷ್ಟು, ಫಸ್ಟ್ಲಿ ಥ್ಯಾಂಕ್ಸ್ ಫಾರ್ ಹೆಲ್ಪಿಂಗ್ ಅಸ್ ಅಂಡರ್ಸ್ಟ್ಯಾಂಡ್ ದ ಫೌಂಡೇಶನ್ ಆಫ್ ಎಸ್ಥೆಟಿಕ್ಸ್ ಟುಡೇ. ಇವೆಲ್ಲ ಒಂದ್ಸತಿ ಮಾಡಿ ಬಿಡುವಂಥದ್ದಲ್ಲ, ಇಟ್ ನೀಡ್ಸ್ ಕೇರ್, ರೆಗ್ಯುಲರ್ ಕೇರ್.
ಹೌದು.
ಸೊ ಯಾರೋ ನೋಡ್ತಾ ಇರೋರ್ಗೀಗ ಹೌ ಆಫನ್ ಶುಡ್ ಅಂದರೆ ಒಂದ್ಸತಿ ಕೈ ಹಾಕಿದ್ರೆ ದಿಸ್ ಇಸ್ ಅ ನೋ ವೇ, ಅಂದರೆ ಒನ್ ವೇ ಸ್ಟ್ರೀಟ್ ಅಲ್ಲ ಇದು.
ಕರೆಕ್ಟ್.
ಸಾರಿ, ರಾದರ್ ಇಟ್ ಇಸ್ ಅ ಒನ್ ವೇ ಸ್ಟ್ರೀಟ್, ಲೈಕ್ ಯು ಎಂಟರ್ ದರ್ ಇಸ್, ಯು ಕಾಂಟ್ ಲೈಕ್ ಕಮ್ ಬ್ಯಾಕ್.
ಕರೆಕ್ಟ್. ಈ ಅಡ್ರೆಸ್ಸಿಂಗ್ ದಿಸ್ ಕ್ವೆಶ್ಚನ್, ಎಲ್ಲರದ್ದು ಫಸ್ಟ್ ಕನ್ಸರ್ನ್ ಏನಿರುತ್ತಂದರೆ, ನಾವು ಇದು ಸ್ಟಾರ್ಟ್ ಮಾಡಿದರೆ ನಾವು ನಿಲ್ಲಿಸ್ಬೋದಾ, ನಿಲ್ಲಿಸಿದ್ರೆ ಏನಾದರೂ ಅಡ್ವರ್ಸ್ ಎಫೆಕ್ಟ್ಸ್ ಇರುತ್ತಾ, ಮೊದಲಕ್ಕಿಂತ ಜಾಸ್ತಿ ಏನಾದರೂ ಈ ಏಜಿಂಗ್ ಪ್ರಾಸೆಸ್ ನಾವು ಇದನ್ನು ಮಾಡ್ತಾಯಿದ್ದೀವಿ ಅದೇನಾದರೂ ಜಾಸ್ತಿ ಆಗ್ಬೋದು ಅಂತ. ಆ ಥರ ಆಗಲ್ಲ. ನಾವು ಒಂದೇ ಸತಿ ಮಾಡಿ ಡಿಸ್ಕಂಟಿನ್ಯೂ ಮಾಡ್ಬೋದು, ಅದರಿಂದ ಏನೂ ಅಡ್ವರ್ಸ್ ಎಫೆಕ್ಟ್ಸ್ ಇಲ್ಲ. ನಾವು ಈ ಮಾಡಿದ್ದು ಆ ಡ್ಯೂರೇಷನಿಗೆ ಪಾಸಿಟಿವ್ಸ್ ಇದ್ದೇ ಇರುತ್ತೆ. ನಿಲ್ಲಿಸಿದ್ರೆ ಅದು ಏನು ರಿವರ್ಸ್ ಆಗಿ ಆಪೋಸಿಟ್ ಡಿರೆಕ್ಷನಲ್ಲಿ ಹೋಗಲ್ಲ. ಆ 6 months ಇರಲಿ, 1 year ಇರಲಿ, ಆ ಗೇನ್ ಮಾಡಿದ್ದು ಅದು ಯಾವಾಗಲೂ ಇದ್ದೇ ಇರುತ್ತೆ. ಒಂದು. ಎರಡನೇದು, ಮೇಂಟೈನ್ ಮಾಡ್ಲಿಕ್ಕೆ ಹೋದರೆ ಎಸ್, ಇದು ಕಂಟಿನ್ಯೂ ಮಾಡಿದರೆ ಒಳ್ಳೆಯದು. ಅದರದ್ದು ಇಂಪ್ಯಾಕ್ಟ್, ಫಾರ್ ಎಕ್ಸಾಂಪಲ್ ನಾವು ಈ ನೀವು ಬೋಟಾಕ್ಸ್ ಅಂತ ಹೇಳ್ತು, ಆನ್ ಆನ್ ಆ್ಯಾವ್ರೇಜ್ ಇಯರ್ಲಿ ಟ್ವೈಸ್ ಮಾಡಬೇಕಾಗ್ಬೋದು, ಆರ್ ಸಮ್ಟೈಮ್ಸ್ 3 times. ನಾವು ಫಿಲ್ಲರ್ಸ್ ಯೂಸ್ ಮಾಡಿದವಾಗ ವಾಲ್ಯೂಮ್ ಬಿಲ್ಡ್ ಮಾಡಲಿಕ್ಕೆ, ಲಿಫ್ಟಿಂಗ್ ಇರಲಿ, ಕಾಂಟೋರಿಂಗಿಗಿರಲಿ, ಅದು ಆನ್ ಆನ್ ಆ್ಯಾವ್ರೇಜ್ 1.5 years ಇರುತ್ತೆ. ಈ ಬೇರೆ ರೀಸರ್ಫೇಸಿಂಗ್ ಟ್ರೀಟ್ಮೆಂಟ್ಸ್ ನಾವು ಮೆನ್ಷನ್ ಮಾಡ್ತಲ್ಲ, ಈ ಪೀಲ್ಸ್ ಅಂತ, ಲೇಸರ್ ರೀಸರ್ಫೇಸಿಂಗ್ ಇರಲಿ, ಅದೆಲ್ಲ ಆನ್ ಆನ್ ಆ್ಯಾವ್ರೇಜ್ ಒಂದು ಸೆಟ್ ಆಫ್ ಸೆಷನ್ಸ್ ಮಾಡಬೇಕಾಗತ್ತೆ. ಒಂದು ಟಿಪಿಕಲಿ 4 to 6 or 6 to 8 sessions. ಅದಾದಮೇಲೆ ಸಮ್ ಮೇಂಟೆನೆನ್ಸ್ ಬೇಸ್ಡ್ ಆನ್ ದ ಪ್ರಾಬ್ಲಮ್ ಮೇ ಬಿ ರಿಕ್ವೈರ್ಡ್. Medifacials anta have also gained a lot of currency currently.
What is medifacial?
Medi or hydrofacial anta.
Oh, right. That I've seen. Yes. Houdu. There's a device which is trying to suck something out of your skin.
Adu exfoliate ಮಾಡುತ್ತೆ, infuse ಮಾಡುತ್ತೆ, skin and brighten ಮಾಡುತ್ತೆ, fine lines, wrinkles and address ಮಾಡಬಹುದು. It's a very popular kind of a treatment. ಈ salon facials ಮಾಡ್ತಾರಲ್ಲ, ಅದೇ ಥರ ಮೆಡಿಕಲ್ ಗ್ರೇಡ್ ಫೇಶಿಯಲ್ಸ್ ಅಂತ ಹೇಳ್ಬೋದು ಇದು.
Correct.
So ಅದನ್ನು ನಾವು ಮಾಡ್ತಾ ಇರ್ಬೋದು, ಮೇಂಟೈನ್ ಮಾಡ್ತಾ ಇರ್ಬೋದು. ಇನಿಷಿಯಲಿ ಎವ್ರಿ ಫೋರ್ಟ್-ನೈಟ್ ಮಾಡ್ಬೋದು, ಕಡೆಗೆ ತಿಂಗಳಿಗೆ ಒನ್ಸ್ ಇನ್ ಅ ಫ್ಯೂ ಮಂತ್ಸ್, ಆ ಥರನೂ ಇದೆ.
ಸೊ ಟಾಕಿಂಗ್ ಅಬೌಟ್ ಸಮ್ ಟ್ರೀಟ್ಮೆಂಟ್ಸ್ ದಟ್ ಯು ಜಸ್ಟ್ ಮೆನ್ಷನ್, ಐ ಹ್ಯಾವ್ ಅ ಹೋಲ್ ಲಿಸ್ಟ್. ಬಿಫೋರ್ ಐ ಗೆಟ್ ಇನ್ ಟು ದಿ ಅದರ್, ಇದಕ್ಕೆ ಆ್ಯಡ್ ಆಗೋ ಥರ ಇಸ್ ಯುವರ್ ವ್ಯಾಂಪೈರ್ ಫೇಶಿಯಲ್ಸ್ ಆ್ಯಂಡ್ ಯುವರ್ ಕಾರ್ಬನ್ ಫೇಶಿಯಲ್,
ಕಾರ್ಬನ್ ಪೀಲ್
or something like that. So can you help us understand, firstly, vampire facial and Takshan, I was like, oh, what is this blood sucking facial? So where are these coming from, firstly, these trends?
Vampire facial ಅಂದರೆ ಪ್ರೈಮರಿಲಿ ಅದರಲ್ಲಿ ಏನು ಮಾಡ್ತೀವಿ ಅಂದರೆ, ವಿ ಎಕ್ಸ್ಟ್ರಾಕ್ಟ್ ಪೆರಿಫರಲ್ ಬ್ಲಡ್, ಅದರಲ್ಲಿ ಪ್ಲೇಟ್ಲೆಟ್ಸನ್ನು ಸೆಪ್ರೇಟ್ ಮಾಡಿ ಒಂದು PRP ಥರ. ಡಿಫ್ರೆನ್ಸ್ ಬಿಟ್ವೀನ್ ಅ ವ್ಯಾಂಪೈರ್ ಫೇಶಿಯಲ್ ಆ್ಯಂಡ್ ಅ PRP ಪ್ರೊಸೀಜರ್, ಡಿಫ್ರೆನ್ಸ್ ಏನಂದರೆ, ಇದರಲ್ಲಿ PRPಲಿ ನಾವು ಈ ಪ್ಲೇಟ್ಲೆಟ್ ಕಾನ್ಸಂಟ್ರೇಟನ್ನು ಆ್ಯಕ್ಟಿವೇಟ್ ಮಾಡಿ ಸ್ಕಿನ್ನಿಗೆ ಇಂಜೆಕ್ಟ್ ಮಾಡ್ತೀವಿ ಯೂಸಿಂಗ್ ಅ ವೆರಿ ಫೈನ್ ನೀಡಲ್, ಸ್ವಲ್ಪ ಎನೆಸ್ಥೆಟಿಕ್ ಕ್ರೀಮ್ ಯೂಸ್ ಮಾಡಿ. ವ್ಯಾಂಪೈರ್ ಫೇಶಿಯಲಲ್ಲಿ ಅದನ್ನು ಇಂಜೆಕ್ಟ್ ಮಾಡಲ್ಲ, ಯೂಸಿಂಗ್ ಅ ಡರ್ಮರ್ ರೋಲರ್ ಅದನ್ನು ಸ್ಕಿನ್ನಿಗೆ ಇನ್ಫ್ಯೂಸ್ ಮಾಡ್ಬೋದು.
Okay, so it's not the needle, it's a roller.
It's a roller. ಅದರ ಮುಖಾಂತರ ಪ್ರಾಡಕ್ಟ್ ಗೋಸ್ ಇನ್ ಟು ದ ಡರ್ಮಿಸ್.
Got it. So vampire facial ಯಾರಿಗೆ? Who needs it?
Vampire facial is for somebody who's not for the very young, but ಕೆಲವರಿಗೆ those in their mid-30s and above. ಸ್ವಲ್ಪ ಏಜಿಂಗ್ ಪ್ರಾಸೆಸ್ ಶುರುವಾಗಿದೆ, ಪಿಗ್ಮೆಂಟ್ರಿ ಚೇಂಜಸ್ ಇರ್ಬೋದು, ಲ್ಯಾಕ್ ಕ್ಲಸ್ಟರ್ ಸ್ಕಿನ್. ಸೊ ಇಟ್ಸ್ ಅ ಗುಡ್ ಟ್ರೀಟ್ಮೆಂಟ್.
ಹೌ ಆಫನ್ ಇದು ತಗೋಬೇಕು?
ವ್ಯಾಂಪೈರ್ ಫೇಶಿಯಲ್ಸ್ ಐ ವುಡ್ ಥಿಂಕ್ ಇದು ಯಾವುದು ಫ್ರೀಕ್ವೆಂಟಾಗಿ ಮಾಡಬೇಕಂತನಿಲ್ಲ. ಐ ಥಿಂಕ್ ಆನ್ ಆನ್ ಆ್ಯಾವ್ರೇಜ್ ವ್ಯಾಂಪೈರ್ ಫೇಶಿಯಲ್ಸ್ ಮಾಡಿದರೆ ಒನ್ಸ್ ಇನ್ 3 months or 6 months ಮಾಡಿದರೆ ಇಟ್ಸ್ ನಾಟ್ ಅ ಬ್ಯಾಡ್ ಆಪ್ಷನ್.
The facial term ಅದು ತುಂಬ ಬ್ಯೂಟಿ ಪಾರ್ಲರ್ ಇಂಡಸ್ಟ್ರಿನವರು ನಮಗೆ ಅದನ್ನು ನಾರ್ಮಲೈಸ್ ಮಾಡಿಸಿದ್ದು. ಏನೋ ಫ್ರೂಟ್ ಫೇಶಿಯಲ್ ಅಂತೆ, ಚಾಕ್ಲೇಟ್ ಫೇಶಿಯಲ್. ವೆನ್ ಯು ಆ್ಯಕ್ಚುಲಿ ಎಂಟರ್ ಅನ್ ಏಸ್ಥೆಟಿಕ್ ಸೆಂಟರ್, ದ ಫೇಶಿಯಲ್ಸ್ ದಟ್ ಯು ಸಿ ಆ್ಯಂಡ್ ದ ಪ್ರೊಸೀಜರ್ ಆ್ಯಂಡ್ ಡಾಕ್ಟರ್ ಸೂಪರ್ವಿಷನ್ ಅದರ ಕೆಳಗೆ ನಡೆಯೋದೇ ಬೇರೆ. ಸೊ ವಾಟ್ಸ್ ದ ಕಾಸ್ಟ್ ಎಫೆಕ್ಟಿವ್ನೆಸ್ ಆಫ್ ದೀಸ್ ಫೇಶಿಯಲ್ಸ್ ಆ್ಯಂಡ್ what are your thoughts on the facials which is happening at home wherein people are taking steam ಮತ್ತೆ ಏನೋ ಒಂದು ಫೇಸ್ ಪ್ಯಾಕ್ ಹಾಕೊಂತಾರೆ? ವಾಟ್ ಇಸ್ ದ ರಿಯಾಲಿಟಿ ಆಫ್ ಬೋತ್ ದ ವರ್ಲ್ಡ್ಸ್?
ನೋಡಿ, ಹೋಮ್ ರೆಮಿಡೀಸ್ ಆರ್ ಹೋಮ್ ಮಾಸ್ಕ್ಸ್ ಆ್ಯಂಡ್ ಪೀಲ್ಸ್ ಅದು ಯಾವುದು ಸ್ಟ್ರಕ್ಚರ್ಡ್ ಅಲ್ಲ. ಥ್ಯಾಂಕ್ಫುಲಿ ಏನಾಗುತ್ತೆ ಅಂದರೆ ಅಲ್ಲಿ ಯಾವುದರಲ್ಲೂ ಜನರಲಿ ಥಿಂಗ್ಸ್ ಡೋಂಟ್ ಗೋ ರಾಂಗ್.
ಸೈಡ್ ಎಫೆಕ್ಟ್ಸ್
ಯೂಶಲಿ ಇರಲ್ಲ. ಸೈಡ್ ಎಫೆಕ್ಟ್ಸ್ ಇಲ್ದಿದ ಮೇಲೆ ಇಫೆಕ್ಟ್ಸು ನಮಗೆ ಡೇಟಾ ಇಲ್ಲ ಹೇಳಲಿಕ್ಕೆ ಇದು ಮಾಡಿದರೆ ಈ ಥರ ಆಗುತ್ತೆ ಆ ಥರ ಆಗುತ್ತೆ ಅಂತ. ಇಟ್ಸ್ ಅ ವೆರಿ ವಾಟ್ ಇಸ್ ಕಾಲ್ಡ್ ಇಡಿಯೋಸಿನ್ಕ್ರಾಟಿಕ್ ಪ್ರಾಸೆಸ್. ನಾವೇನೋ ಎಲ್ಲೋ ಓದಿರ್ತೀವಿ, ಅದನ್ನು ರೆಪ್ಲಿಕೇಟ್ ಮಾಡ್ತೀವಿ, ಅವ್ರ ಸಂಬಡಿ ಇನ್ ದ ಫ್ಯಾಮಿಲಿ ಸೈಡ್ ಈ ಥರ ಮಾಡೋಣ ಅಂತ ಆ ಥರ. ಸೊ ಜನರಲಿ ಅದು ಎಲ್ಲರೂ ಮಾಡ್ತಾನೆ ಇರ್ತಾರೆ.
ಕಡಲೆ ಹಿಟ್ಟು, ಮೊಸರು,
ಅದು ಇದು ಕಣ್ಣು ಹತ್ರ ಇರ್ಬೋದು, ಫುಲ್ ಫೇಸ್ ಇರ್ಬೋದು, ಬಾಡಿ ಇರ್ಬೋದು. ಸೊ ಪೀಪಲ್ ಆರ್ ಆಲ್ ಫಿಸಿಷಿಯನ್ಸ್ ಎಟ್ ಹಾರ್ಟ್. ಸೊ ಏನೋ ಮಾಡ್ತಾ ಇರ್ತಾರೆ, ಅವ್ರದ್ದೇ ರೆಮಿಡೀಸ್ ಇರುತ್ತೆ. ಸಲಾನ್ ಫೇಶಿಯಲ್ಸ್ ಏನಾಗುತ್ತೆ ಅಂದರೆ ಸ್ವಲ್ಪ ಇಟ್ ಈಸ್ ಮೋರ್ ಸ್ಟ್ರಕ್ಚರ್ಡ್, ರಿಸಲ್ಟ್ಸ್ ಬರುತ್ತೆ, ಬಟ್ ದೇ ಆರ್ ಶಾರ್ಟ್ ಲಿವ್ಡ್. ಸೊ ಏನಾದರೂ ಸ್ಪೆಷಲ್ ಸೋಷಲ್ ಇವೆಂಟ್ಸ್ ಇದ್ದಾವಾಗ, ವೆಡ್ಡಿಂಗ್ಸ್ ಆ್ಯಂಡ್ ಅದರ್ ಇವೆಂಟ್ಸ್, ಆವಾಗ ಸಲಾನ್ ಫೇಶಿಯಲ್ಸ್ ಹೆಲ್ಪ್. ಆ ಬ್ರೈಟ್ನೆಸ್ ಗ್ಲೋ ಒಂದು 2-3-4 days ಬರುತ್ತೆ ಆ್ಯಂಡ್ ಇಟ್ ಸರ್ವ್ಸ್ ದ ಪರ್ಪಸ್. ಮೆಡಿಕಲ್ ಗ್ರೇಡ್ ಫೇಶಿಯಲ್ಸ್ ಮಾಡಿದವಾಗ ಶಾರ್ಟ್ ಟರ್ಮ್ ಬೆನಿಫಿಟ್ಸು ಇರುತ್ತೆ ಆ್ಯಂಡ್ ಮಿಡ್ ಟರ್ಮ್ ಬೆನಿಫಿಟ್ಸು ಬರುತ್ತೆ.
ಮಿಡ್ ಟರ್ಮ್ ಅಂದರೆ
ಒಂದು ಪ್ರಾಬಬ್ಲಿ ಅ ಫ್ಯೂ ವೀಕ್ಸ್ ಆರ್ ಅ ಮಂತ್ ಆ್ಯಂಡ್ ಸೊ ಆನ್. ಸೊ ಅದನ್ನು ನಾವು ಕಂಟಿನ್ಯೂಸ್ ಆಗಿ ಮಾಡ್ತಾ ಇದ್ದವಾಗ ಇಟ್ ಆ್ಯಡ್ಸ್ ಅಪ್ ಆ್ಯಂಡ್ ಯು ಕ್ಯಾನ್ ಮೇಂಟೈನ್ ರಿಸಲ್ಟ್ಸ್ ಫಾರ್ ಲಾಂಗರ್.
ಇಸ್ ಇಟ್ ಲೈಕ್ ಡ್ರಗ್? ಅಂದರೆ ಒನ್ಸ್ ಯುವರ್ ಸ್ಕಿನ್ ಅದು ಎಕ್ಸ್ಪೋಸ್ ಆದ ತಕ್ಷಣ, ಅದು ಬಿಟ್ಟ ತಕ್ಷಣ ಸಡನ್ಲಿ ದ ಫೇಸ್ ವಿಲ್ ಲುಕ್ ಡಲ್, ಇದೆಲ್ಲ ಮಿತ್ಸ್ ಅಥವಾ ಇಸ್ ದೇರ್ ಎನಿ ಟ್ರೂತ್ ಟು ಇಟ್?
ಐ ಥಿಂಕ್ ಇಟ್ ಈಸ್ ಪಾರ್ಟ್ಲಿ ಮಿತ್. ಸ್ಕಿನ್ ಕ್ಯಾನ್ ಜನರಲಿ ಲುಕ್ ಆಫ್ಟರ್ ಇಟ್ ಸೆಲ್ಫ್. ನಾವೇನು ಮಾಡಬೇಕಂದ್ರೆ ಅದಕ್ಕೆ ಒಂದು ಬೇಸಿಕ್ ರೂಟೀನ್ ಬೇಸಿಕ್ ಕೇರ್ ಇರುತ್ತಲ್ಲ, ಅದನ್ನು ನಾವು ಅಡ್ಮಿನಿಸ್ಟರ್ ಮಾಡಬೇಕು, ಫಾಲೋ ಮಾಡಬೇಕು. ಅಷ್ಟು ಮಾಡಿದರೆ ಜನರಲಿ ನಮ್ದು ಈಗ ಕಾಂಪ್ಲೆಕ್ಸ್ ಡೈಲಿ ರೂಟೀನ್ಸ್, ಅದು ಇದು, ಮಾರ್ನಿಂಗ್ ಡಜನ್ ಪ್ರಾಡಕ್ಟ್ಸ್, ನೈಟ್ ಇನ್ನೊಂದಷ್ಟು, ನಾಟ್ ನೆಸೆಸರಿ. ಸಮಟೈಮ್ಸ್ ಲೈಕ್ ದೇ ಸೇ ಹಾರ್ಸಸ್ ಫಾರ್ ಕೋರ್ಸಸ್ ಅಂತ. ವಿ ನೀಡ್ ಟು ಚೂಸ್ ವಾಟ್ ಈಸ್ ನೆಸೆಸರಿ, ನಾಟ್ ವಾಟ್ ಯು ರೀಡ್.
ವಾವ್. So what is now necessity and what is that is a distraction? Firstly, hearing from the horse's mouth, what is the basics of a skincare today in all the technological advancements and all the skincare regime?
The basic requirements ಏನಂದರೆ ಒಂದು ಕ್ಲೆನ್ಸಿಂಗ್. ಸೊ ಬೇಸ್ಡ್ ಆನ್ ದಿ ಎನ್ವೈರನ್ಮೆಂಟ್ ಆ್ಯಂಡ್ ವೇ ವಿ ಲಿವ್, ವಿಚ್ ಪಾರ್ಟ್ ಆಫ್ ದ ವರ್ಲ್ಡ್, ಕ್ಲೆನ್ಸಿಂಗ್ ಅಂತೂ ಎಲ್ಲಿದ್ದರೂ ಒಂದು ಕ್ಲೆನ್ಸ್ ಮಾಡಬೇಕು.
ಇಂಡಿಯಾ,
ಕರ್ನಾಟಕ ಅಂದರೆ ನಾರ್ತ್ ಸೌತ್ ಡಿಪೆಂಡ್ಸ್, ವಾಟ್ ಎವರ್. ಕ್ಲೆನ್ಸಿಂಗ್ ಆನ್ ಆನ್ ಆ್ಯಾವ್ರೇಜ್ ಒಂದು 2 times ಅದರಲ್ಲಿ ಮಾಡಬೇಕಾಗತ್ತೆ. ನೋಡಿ, ಯು ಮೇ ಹ್ಯಾವ್ ಅ ಲಾಟ್ ಆಫ್ ಪೀಪಲ್ ಹೂ ಸೇ ನಾನು ಚೈಲ್ಡ್ಹುಡ್ಡಿಂದ ಅದೇ ಸೋಪ್ ಯೂಸ್ ಮಾಡ್ತಾ ಇದ್ದೀನಿ, ನನಗೆ ಏನೋ ಐ ಆಮ್ ಯೂಸ್ ಟು ಇಟ್, ಸ್ವಲ್ಪ ಚೇಂಜ್ ಮಾಡಿದರೆ ಏನಾದರೂ ಇದಾಗುತ್ತೆ ಅಂತ. ಇಟ್ ಇಸ್ ಪ್ರಾಬಬ್ಲಿ ಟ್ರೂ. ಸೊ it is not right to say soaps use ಮಾಡಬಾರ್ದು, ಬರೀ ಜೆಂಟಲ್ ಕ್ಲೆನ್ಸರ್ಸ್ ಯೂಸ್ ಮಾಡಬೇಕು, ಆರ್ ಫೇಸ್ ವಾಷಸ್ ಯೂಸ್ ಮಾಡಬೇಕು, ಫೋಮಿಂಗ್ ನಾನ್ ಫೋಮಿಂಗ್ ಯಾವುದೇ ಇರಲಿ. that's not written in stone. ಸೊ ಎಸೆನ್ಷಿಯಲಿ ಸ್ಕಿನ್ ಟೈಪನ್ನು ನೋಡಬೇಕಾಗತ್ತೆ. ಸೊ ಇಫ್ ಯು ಹ್ಯಾವ್ ಆಬ್ವಿಯಸ್ಲಿ an oily kind of a skin, foam based or a slightly more aggressive cleanser, soap use ಮಾಡಿದ್ರು ತೊಂದರೆ ಇಲ್ಲ.
Okay.
So but dry skin ಇದ್ದಾವಾಗ you want a gentler cleanser, preferably a soap free cleanser. ಆ ಥರ. And sometimes depending on the season of the year, ಈ cleansers ನಾವು ಚೇಂಜ್ ಮಾಡಬೇಕಾಗ್ಬೋದು.
Seasons meaning for example
summerಲ್ಲಿ ಸ್ವಲ್ಪ slightly more aggressive, and the colder months of the year ಆವಾಗ ಸ್ವಲ್ಪ gentler cleansers ಬೇಕಾಗ್ಬೋದು. So the choice of a cleanser depends upon the age of the person and the nature of the skin.
So how do we generalize this? For example, ಈಗ 20ರಿಂದ 30 ವಯಸ್ಸನ್ನ ಯಾರೋ ನೋಡ್ತಾ ಇದ್ದಾರೆ. ಏಜ್ ವೈಸ್ ಯು ಕ್ಯಾನ್ ಹೆಲ್ಪ್ ಅಸ್ ಅಂಡರ್ಸ್ಟ್ಯಾಂಡ್, ಪ್ಲಸ್ ಆಫ್ ಕೋರ್ಸ್ ಏಜ್ ಅಂದರೆ ಸ್ಕಿನ್ ಕಾಂಬಿನೇಷನ್.
ಹೌದು. ಸೊ ಅಡಲ್ಟ್ ಸ್ಕಿನ್ oily skin. Usually, sometimes now oily skin or dry skin ಅಂತ ಹೇಳಲಿಕ್ಕಾಗಲ್ಲ. It's a combination kind of a skin. Some zones ಸ್ವಲ್ಪ T zone ನೀವು ಹೇಳಿತರ it could be oilier and the V zone could be drier.
V is this,
the V
is this, T is
the
this.
T is that, or the area around the mouth, for example. So aವಾಗ best ಕೆಲವ್ರು ಕೇಳುವ how do I know what kind of skin I have? ಸೊ ಅವಾಗ ಏನಾಗುತ್ತೆ ಅಂದರೆ ಒನ್ಸ್ ಯು ಯೂಸ್ ಅ ಕ್ಲೆನ್ಸರ್, ಸೊ ಯಾವುದೇ ಇರಲಿ, ಸೋಪ್ ಇರಲಿ, ಫೇಸ್ ವಾಶ್ ಇರಲಿ, ಅದು ಯೂಸ್ ಮಾಡಿದ ತಕ್ಷಣ ಒನ್ಸ್ ಯು ಡ್ರೈ ದ ಸ್ಕಿನ್ ವಿತ್ ದ ಟವಲ್ ಆ್ಯಂಡ್ ಆವಾಗ ಸ್ಕಿನ್ ಫೀಲ್ ಸ್ಟ್ರೆಚ್ಡ್, ಇಟ್ ಟೆಲ್ಸ್ ಯು ಯು ಹ್ಯಾವ್ ಡಿಪ್ಲೀಟೆಡ್ ದ ಮಾಯ್ಸ್ಚರ್. That means you are on the drier side. And which portions of the skin go dry tells you what kind of skin you have. ಇಲ್ಲ ಬರೀ around the central part of the face, around the mouth ಸ್ವಲ್ಪ dryness ಬಂತು, cheeks ಮೇಲೆ ಸೈಡಿಗೆ ಅಷ್ಟು ಇರಲಿಲ್ಲ ಅಂದರೆ it's more like a combination kind of skin.
That's how you know your skin.
That's how you know your skin. So basically nobody knows your skin better than you because you're looking at it every morning in the mirror.
And you're cleansing it.
ಹೌದು, ಅದು ಒಂದು. ಸೊ ಇಲ್ಲ ಯೂನಿಫಾರ್ಮ್ಲಿ ಎಲ್ಲ ಕಡೆ ಡ್ರೈ ಆಗ್ತಾ ಇದೆ ಅಂದರೆ ಇಟ್ಸ್ ಆನ್ ದ ಡ್ರೈಯರ್ ಸೈಡ್. ಕೆಲವರಿಗೆ ನಾರ್ಮಲ್ ಟು ಆಯ್ಲಿ ಇರ್ಬೋದು, ನಾರ್ಮಲ್ ಸ್ಕಿನ್ ಇರ್ಬೋದು, ಏನೋ ವಾಶ್ ಮಾಡಿದ ಮೇಲೂ ಏನು ಚೇಂಜಸ್ ಕಾಣಿಸ್ತಾ ಇಲ್ಲ. ಸೊ ಆ ಥರ. ಸೊ ಕ್ಲೆನ್ಸಿಂಗ್ ಆದಮೇಲೆ ಅಗೇನ್ ಬೇಸ್ಡ್ ಆನ್ ಸ್ಕಿನ್ ಟೈಪ್ ಒಂದು ಮಾಯ್ಶ್ಚರೈಸರ್ ಪಿಕ್ ಮಾಡಬೇಕು ನಾವು. ಸೊ ಮಾಯ್ಶ್ಚರೈಸರ್ ಅಗೇನ್ ಡಿಪೆಂಡಿಂಗ್ ಆನ್ ದ ಸ್ಕಿನ್ ಟೈಪ್. ಕೆಲವರಿಗೆ ಸ್ಲೈಟ್ಲಿ ಥಿಕ್ಕರ್ ಟೆಕ್ಸ್ಚರ್ಡ್ ಮಾಯ್ಶ್ಚರೈಸರ್ಸ್ ಬೇಕಾಗ್ಬೋದು, ಕೆಲವರಿಗೆ ಹ್ಯಾಸ್ ಟು ಬಿ ಮೋರ್ ಜೆಲ್ ಬೇಸ್ಡ್, ಇಲ್ಲಾಂದರೆ ಆಯ್ಲಿ ಕಾಣಿಸುತ್ತೆ. ಡಿಪೆಂಡ್ಸ್ ಆನ್ ಅದರ್ ಪೀಪಲ್ ಗೋಯಿಂಗ್ ಟು ವರ್ಕ್, ಮೇಕಪ್ ರೂಟೀನ್ಸ್, all dictates the kind of moisturizer that you pick.
Doctor, I have a question here. So, under India, we have seen from ponds to snail mucin, which is a trend today. ಹೆಂಗಾಗ್ಬಿಟ್ಟಿದೆ ಅಂದರೆ ದಿನ ಬೆಳಗಾದರೆ ಒಬ್ರು ಏನೋ ಹೇಳ್ತಾ ಇದ್ದಾರೆ, ವಾಟ್ ಟು ಫಾಲೋ, ವಾಟ್ ನಾಟ್ ಟು ಅನ್ನೋದು ಇಸ್ ದ ಬಿಗ್ಗೆಸ್ಟ್ ಕನ್ಫ್ಯೂಷನ್. ಹೆನ್ಸ್ ಬ್ರಿಂಗಿಂಗ್ ಟು ಮೈ ನೆಕ್ಸ್ಟ್ ಕ್ವೆಶ್ಚನ್, ಐ ಹ್ಯಾವ್ ಅ ಸೆಟ್ ಆಫ್ ಕ್ರೀಮ್ಸ್. ಅಂದರೆ ಮೊದಲೆಲ್ಲ ಆ್ಯಸ್ ಅ ಕಿಡ್ ಐ ರಿಮೆಂಬರ್, ಲೈಕ್ ಯಾರೋ ಅಜ್ಜಿ ಅಥವಾ ಅಮ್ಮ ಒಂದು ಪಾಂಡ್ಸ್ ಹಚ್ಕೊಳ್ಳೋರು, ಆಮೇಲೆ ಬಂತು ಯುವರ್ ಫೇರ್ ಎವರು, ಫೇರ್ ಆ್ಯಂಡ್ ಲವ್ಲಿ. That fair cream syndrome India went through. I think 90s, late 90s, till the recent. Later somebody told, no, you have to be sensitive. What is this fair? No, respect everything is, idu awareness shuru aitu. So now the question is, routine anta bandaga, I'll name few creams, doctor. Idin heli yarige yen anta. ಫಸ್ಟ್ಲಿ ನೀವೊಂದು ಮಾಯ್ಶ್ಚರೈಸರ್ ಅಂತ ಹೇಳಿದ್ರಿ, ಮೊದಲು ಅಲ್ಲಿಗೆ ಕೋಲ್ಡ್ ಕ್ರೀಮ್ ಅಂತಲೇ ಇದ್ದಿದ್ದು. ದೀಸ್ ಟ್ರೆಂಡ್ಸ್, ಫಸ್ಟ್ಲಿ ವೈಟಮಿನ್ ಸಿ, ವಿಚ್ ಇಸ್ ಅ ಸೀರಮ್ ಆಫ್ಟರ್ ಯು ವಾಶ್ ಯುವರ್ ಫೇಸ್. ದಟ್ಸ್ ದಿ ಆಕ್ಟಿವ್ ದಟ್ ದೇ ಕಾಲ್. ಫಸ್ಟ್ ಯು ಹ್ಯಾವ್ ಟು ಅಪ್ಲೈ ದ್ಯಾಟ್. ಸೊ ಡೂ ಯು ರೆಕಮೆಂಡ್ ವೈಟಮಿನ್ ಸಿ?
It's a good product. Yes. Again, you don't have to use it in somebody very young. ನೀವೆಲ್ಲ ಈಗ ಅಡಲ್ಟ್ ಸ್ಕಿನ್ನಿಗೆ ಹೇಳ್ತಾ ಇರೋದಲ್ಲ.
ಅಂದರೆ ಜನರಲಿ ಈ ಪ್ರಾಡಕ್ಟ್ಸು ಯಾರಿಗೆ ಇದು ಸೂಕ್ತ, ಯಾರಿಗೆ ಬೇಕು?
ಅಡಲ್ಟ್ಸ್, not those in the young, in the early 20s. The vitamin C is somebody in the mid to late 20s and above as an antioxidant.
ಸೊ ಇದು ಬೆಳಗ್ಗೆ ಸಾಯಂಕಾಲ ಎರಡು ಯೂಸ್ ಮಾಡಬೇಕು?
ಎರಡು ಹೊತ್ತು ಯೂಸ್ ಮಾಡ್ಬೋದು, ಇಲ್ಲಾಂದರೆ ಬೇರೆ ಪ್ರಾಡಕ್ಟ್ಸ್ ನೋಡಿ ಒಂದು ಹೊತ್ತು ಯೂಸ್ ಮಾಡ್ಬೋದು. 1 to 2 times in a day.
ಬೇರೆ ಪ್ರಾಡಕ್ಟ್ಸ್ ಅಂದರೆ
ಬೇರೆ ಅದರೊಟ್ಟಿಗೆ ಬೇರೆ ಕಾಂಬಿನೇಷನ್ಸ್ ಇರ್ಬೋದು. ಫಾರ್ ಎಕ್ಸಾಂಪಲ್ ನಿಯಾಸಿನಮೈಡ್, ರೆಟಿನಾಲ್ಸ್ ಅಂಡ್ ಸೊ ಆನ್. ನಿಮ್ಮ ಕ್ವೆಶ್ಚನ್ಸ್ ಐ ಥಿಂಕ್.
ಎಸ್. ದ ನೆಕ್ಸ್ಟ್ ಲೇಬಲ್ ಟುಡೇ, ಹೈಲುರಾನಿಕ್ ಆಸಿಡ್. ಏನು ಹಿಂಗಂದರೆ ಇದು ನಮ್ಮ ಸ್ಕಿನ್ ಮೇಲೆ ಏನು ಮಾಡುತ್ತೆ?
Hyaluronic acid is normally present in the skin as an ingredient. Although its primary role is to bind water. So it binds water in skin. Now fillers anta mention madidnalla, most fillers consist of hyaluronic acid, if not all. So the role is to bind water. So hyaluronic acid in the form of a serum or a gel aids in that process. So as a moisturizer.
So it helps to retain water in the skin.
It helps to retain water. Endogenous hyaluronic acid. ಅಂದರೆ ಒಳಗಿದ್ದಿದ್ದು, ಡರ್ಮಿಸ್ ಅಲ್ಲಿ ಪ್ರೊಡ್ಯೂಸ್ ಮಾಡಿದ್ದು, that holds water. Externally applied hyaluronic acid, it's a little complex. The science is complex. The molecular size ನಾವು ನೋಡಬೇಕು. Any size will not penetrate the skin. ಆ ಥರ ಇದೆ. But an appropriately created product can bypass those barriers and enter the skin.
So hyaluronic acid is ಯಾರಿಗೆ, ಯಾವ ವಯಸ್ಸಲ್ಲಿರೋರಿಗೆ?
I think in those in their late 20s and above. As especially for those with slightly dry skin.
So I'm also a fan of Murad products. So when I was reading through Dr. Howard Murad, he has his own range of products. ಅವ್ರು ಏನೋ ಪುಸ್ತಕ ಎಲ್ಲ ಬರೆದಿದ್ದಾರಲ್ಲ ಡಾಕ್ಟರ್, 2 ಫರ್ಗೆಟಿಂಗ್ ದ ನೇಮ್ಸ್, ಬಟ್ ಎನಿವೇ ಅವ್ರು ಅದರಲ್ಲೆಲ್ಲೋ ಹೇಳ್ತಾರೆ ಲೈಕ್ ಮಗು ಆಗಿದ್ದಾಗ 65% or 75% ಆಫ್ ದ ಹೋಲ್ ಮಗುದು our composition is 65 to 75% water. ನಾವು ಏಜ್ ಆಗ್ತಿದ್ದಂಗೆ ವಿ ಸ್ಟಾರ್ಟ್ ಟು ಲೂಸ್ ವಾಟರ್. ದಟ್ಸ್ ವೈ ದಟ್ ಏನೋ ಬೇಬಿ ಫ್ಯಾಟು, ಪ್ಲಂಪಿಯರ್ ಸ್ಕಿನ್ನು ಅದೆಲ್ಲ ಹೋಗ್ತಾ ವಯಸ್ಸಾಗ್ತಾ ಇಟ್ ಡ್ರೈಸ್ ಡೌನ್ ಅಂತ. ಸೊ ಬ್ರಿಂಗಿಂಗ್ ಬ್ಯಾಕ್ ಟು the connection wherein why we should retain water. Is there any other way internally to retain water in the body which will eventually make us look young?
Oral collagen supplements. Nodi, I've been a skeptic about oral collagen for a long time. But data ide. There's enough data to say that it makes a difference. It improves skin quality, improves hydration, elasticity, and everything else. So there's data. So although logic doesn't make sense in terms of why consuming collagen should impact the skin directly, it's like consuming a protein source. So protein eventually once it enters your system, it is broken down to amino acids, which are then carried through the system, reassembled, and so on. So it's not like the collagen now consumed by collagen directly shows up in the skin. But data ide. So I'll have to go by data, not by what I feel. So data says yes, collagen is good. It does make a difference to the skin quality.
So you are in favor of people having those with the water idella mix ಮಾಡಿ ಕುಡಿದಾರಲ್ಲ?
I think
Nutrova ಅಥವಾ some
Nutrova and others. Primarily, if you ask me, all your source of all of these nutrients have to come through the diet.
Food.
Absolutely. That is the basic premise. Only in special circumstances we need additional things. Supplements. We live in a world of supplements. Elladakku one supplement ide. But it is not right to project that as the primary thing to do. So diet is the key. Add-ons can come at different phases in your life.
Collagen usually skin cream ಮೂಲಕ can the skin absorb ಅಥವಾ like you said diet ಅಲ್ಲೇ ಹೋಗಬೇಕು. So if you say skin cream ನ ಮೂಲಕ collagen ಒಳಗೆ ಹೋಗಲ್ಲ ಅಂದರೆ ಡಯಟ್ ಯಾವ ಆಹಾರದಲ್ಲಿ collagen ನಾವು ನೋಡ್ಬೋದು apart from the supplements?
ಅಂದರೆ ನಮ್ಮದು ಬೇಸಿಕ್ಲಿ collagen ಅಂದರೆ it has to be a protein source. Non-veg or vegetarian sources
Fish,
of protein. Non-veg, all of this will give you the protein. Veg, the number of sources start to drop. But, I mean, there are enough sources. So, ಅದನ್ನು ನಾವು ಯೂಸ್ ಮಾಡಬೇಕು. ಸೊ ಆ ಥರ. ಸೊ ನಮಗೆ ಎಸೆನ್ಷಿಯಲಿ ನಮ್ಮದು ಪ್ರೋಟೀನ್ ರಿಕ್ವೈರ್ಮೆಂಟ್ ಇರಲಿ, ಕಾರ್ಬ್ ರಿಕ್ವೈರ್ಮೆಂಟ್ ಇರಲಿ, ಆರ್ ಫ್ಯಾಟ್ ರಿಕ್ವೈರ್ಮೆಂಟ್. ನಾಟ್ ಲೈಕ್ fat is a complete no-no. Nam calories have to come from fat as well. So in the right proportions, like they say, a balanced diet, with these three major players, then the vitamins, the trace elements, minerals, all of these have to come together.
Then automatically the collagen is taken care of.
Yes, your body is well and truly capable of putting all of that together.
Amazing. Yes. We were talking about creams. I'll come back to that, sir. Vitamin C ಆಯಿತು, hyaluronic acid ಆಯಿತು, retinol. ಅದೊಂದೀಗ ಒಂಥರ ಲೇಟೆಸ್ಟ್.
See, retinol ಅಂದ್ರೆ it's basically a vitamin A analog. It belongs to the vitamin A family. It has remained a gold standard as an anti-aging product. To basically fight fine lines and wrinkles, mottled skin, antara.
Mottled skin
andre skin that has different shades of pigment in it. So typically in Caucasian skin who are sun exposed and weather beaten and photo aged, retinol is a wonderful product to combat signs of skin aging. Indian skin is slightly different. We seem to wrinkle less alla, as to fine lines wrinkles ಸ್ವಲ್ಪ ಕಮ್ಮಿನೇ.
ಯಾಕೆ ಡಾಕ್ಟರ್?
Because all the melanin that our skin has, and which we all love to hate mostly, protects us from UV damage. Absolutely.
Hangidre we should be proud that we have brown skin.
Absolutely. Pigment is all protective. And why do you think namdo risk of cancer is so low in the skin?
It's hard to say
in our population? It's the pigment. Caucasians do not have that protection, and therefore UV damage leads to a higher incidence of malignancies. So coming back
Retinol.
to retinol. So retinol, gold standard, no dispute, wonder drug. However, there's a place for retinol. Now, globally, somebody is using retinol in New Zealand and doesn't mean you have to jump and get your tube of retinol. No harm, but it's not like an absolute must. But in a daily routine, if somebody says, retinol use ಮಾಡ್ತಾ ಇದೀನಿ, I'm not going to say, no, stop your retinol. Wonderful. But if somebody says, when do I start my retinol? I'm turning 29 or 30. I'll say, at the appropriate time. There's no rush.
Wait it out. So what is the appropriate time? Or what are the symptoms telling you?
I think ಅದೇ ಹೇಳಿದ್ನಲ್ಲ, ultimately we have to look at the context of the skin and the skin type, the age and the aging that you see before choosing this basket.
So lines.
How the fine lines, wrinkles. Of course, now fine lines, wrinkles barbekan kaibekanteniಲ್ಲ. It is to prevent it that we are recommending it. So, yes, retinol gets a double tick, good product, and as were the earlier two, we talked of hyaluronic and vitamin C. All three will find their way into somebody's routine at some point in time.
Munde, Panthenol. Panthenol. What is this? Recently I started reading about this.
Dexpanthenol, is it?
Just Panthenol or
Panthenol. They're all, it's a vitamin again meant to hydrate. So I think one of the key elements for skin is hydration. If you say what are the two key things that we need to look at for the skin? Hydrate adequately when needed.
External and internal.
External, primary. Internally, we are supposed to be drinking water, eating whatever. Ad hego, irrespective of whether you have good skin or not, adu madlebeku, because we are more than the skin. We need to look at all the other organs. Absolutely. So, ad hego aito. Externally, based on the skin type, hydration. Yeradnedu, sun protection. Idu yerad madidre, you don't need a host of other things.
Sun protection, and again, there's a lot of myth. Like recently, I also got to know, ನೀವು ಮನೆಯೊಳಗೆ ಕೂತ್ಕೊಂಡಿದ್ರು ಅಲ್ಲೂ ಯು ವಿ ರೇಸ್ ಬರುತ್ತೆ, ಕಾರಲ್ಲಿ ಕೂತ್ಕೊಂಡಿದ್ರು ಬರುತ್ತೆ. ಬಟ್ ನಮ್ಮ ಮಿತ್ ಅಥವಾ ನಮ್ಮ ಮಿಸ್ಕನ್ಸೆಪ್ಷನ್ ಇಸ್ ಆಲ್ವೇಸ್ ನಾನು ಆಚೆ ಹೋದಾಗ ಮಾತ್ರ ಹಾಕಬೇಕು. ಆ್ಯಂಡ್ ಅದರಲ್ಲೂ ತುಂಬ ಇದಿದೆ. ಕ್ಯಾನ್ ಯು ಪ್ಲೀಸ್ ಟೆಲ್ ಅಸ್ ಲೆವೆಲ್ಸ್ ಆಫ್ ಸನ್ಸ್ಕ್ರೀನ್ ಅಪ್ಲಿಕೇಶನ್, ಪ್ರೈಮರಿಲಿ ವೇರ್ ಟು ಸ್ಟಾರ್ಟ್, ವೇರ್ ಆಲ್, ಲೈಕ್ ಯಾವ್ಯಾವ ಒಕೇಶನಲ್ಲಿ ಅದು?
ಐ ಥಿಂಕ್ ಸನ್ ಬ್ಲಾಕ್ ಇಸ್ ಇಂಪಾರ್ಟೆಂಟ್. ಯಾಕಂದರೆ ಅದು ಎರಡು ಕಾಂಟೆಕ್ಸ್ಟ್ ಇದೆ. ಕೆಲವರಿಗೆ ಸನ್ ಅಲರ್ಜೀಸ್ ಇರುತ್ತೆ, ಸನ್ ಇಂಡ್ಯೂಸ್ಡ್ ಸ್ಕಿನ್ ಪ್ರಾಬ್ಲಮ್ಸ್, ಆವಾಗ ಹಾಕಲೇಬೇಕು. ಮೋಸ್ಟ್ ಪೀಪಲ್ ಆರ್ ಕನ್ಸರ್ನ್ಡ್ ಅಬೌಟ್ ಅ ಸ್ಕಿನ್ ಟ್ಯಾನ್ ವೆನ್ ದೇ ಆರ್ ಔಟ್ಡೋರ್ಸ್. ಅದನ್ನು ಕಮ್ಮಿ ಮಾಡಲಿಕ್ಕೆ ಯು ಕಾಂಟ್ ನೆಗೆಟ್ ಇಟ್ ಫುಲ್ಲಿ, ಬಟ್ ಸನ್ ಬ್ಲಾಕ್ಸ್ ಯೂಸ್ ಮಾಡ್ತೀವಿ. ಆ್ಯಂಡ್ ದ ಥರ್ಡ್ ಕ್ಯಾಟಗರಿ ಈಸ್ ಯು ವಾಂಟ್ ಟು ಪ್ರಿವೆಂಟ್ ಫೋಟೋ ಏಜಿಂಗ್. ಫೋಟೋ ಏಜಿಂಗ್ ಏನಾಗುತ್ತೆ ಅಂದರೆ ಇಟ್ ಡಸಂಟ್ ಶೋ ಅರ್ಲಿ ಇನ್ ಲೈಫ್. ಅಂದರೆ ಏಜಿಂಗ್ ಇಂಡ್ಯೂಸ್ಡ್ ಬೈ UV light.
I think I saw a photo of a worker, truck driver allo US ಅಲ್ಲಿ, half face ಈ ಕಡೆ ಬಿಸಿಲಿಗೆ ಬಂದಿದೆ, ತುಂಬಾ ಜಾಸ್ತಿ ರಿಂಕಲ್ ಬಂದ್ಬಿಟ್ಟಿದೆ.
ಕರೆಕ್ಟ್.
ಈ ಕಡೆದು ಎಕ್ಸ್ಪೋಸ್ ಆಗಿಲ್ದಿರ ಸ್ವಲ್ಪ ಬೆಟರ್ ಆಗಿತ್ತು.
ಕರೆಕ್ಟ್. ಸೊ ರೈಟ್. ಸೊ Caucasians ಏನಾಗುತ್ತೆ ಅಂದರೆ ದೇ ಏಜ್ ಬೈ ಶೋಯಿಂಗ್ ದ ಸೈನ್ಸ್ ಯು ಮೆನ್ಷನ್ ಜಸ್ಟ್ ನೌ. ಫೈನ್ ಲೈನ್ಸ್, wrinkles, coarse skin and some pigmentary changes. Indians aging, fine lines, wrinkles, but other truck driver, had he been in India, you wouldn't see so many lines, but you would probably see a lot of pigmentation. So we age with a lot of pigmentary changes. In that context, a sunblock is important. Adu when you're in your 20s, 30s, alla kansalla. When you're much older, adan prevent madlikke sunblock, using a sunblock earlier is good.
Sudden one day we see like our relative ಚೆನ್ನಾಗೇ ಇರ್ತಾರೆ, ಈ ಕೆನ್ನೆ ಮೇಲೆ ಸಡನ್ನಾಗಿ ಇಲ್ಲಿ ವಿ ಸಿ ದ್ಯಾಟ್ ಪಿಗ್ಮೆಂಟೇಷನ್. ಸೊ ಇದೆಲ್ಲ ಸಣ್ಣ ಬ್ಲಾಕ್ ಇಲ್ಲದೆ ಇರೋದು ಒನ್ ಆಫ್ ದ ರೀಸನ್.
ಕುಡ್ ಬಿ, ಬಟ್ ಬೇರೆ ಫ್ಯಾಕ್ಟರ್ಸು ಇರುತ್ತೆ ಆ ಪಿಗ್ಮೆಂಟೇಷನ್ಗೆ. ಅಫ್ಕೋರ್ಸ್ there could be melasma, which is a common pattern of pigment. It could be other hormonal issues. So we need to check. So we cannot put all of them under one basket.
Okay. So yes, ಮುಂದೆ collagen ಬಗ್ಗೆ ಮಾತಾಡಿದ್ವಿ. So you don't advocate cream ಮೂಲಕ collagen?
No. Collagen in a cream doesn't work other than hydration because of the cream itself. But collagen internally through the diet, which helps build collagen in the skin, protein consumption and the rest help build collagen along with other cofactors, is useful. And collagen supplements taken orally there's data to say it helps.
Wake up to fresh ideas. Repose.
ಮುಂದೆ ನಿಯಾಸಿನಮೈಡ್ ಏನು ಡಾಕ್ಟರ್ ಇದು ಇಲ್ಲಿವರೆಗೂ ಇವೆಲ್ಲ ಏನು ಯಾವುದೋ ಸೈನ್ಸ್ ಲ್ಯಾಬೇ ಕಾಣ್ತಾ ಇದೆ ಕಣ್ಮುಂದೆ.
Another vitamin, very popular, very, very popular. And niacinamide often goes with vitamin C. So, ನೀವು ಕೇಳಿದ್ರಲ್ಲ vitamin C 2 ಹೊತ್ತು ಯೂಸ್ ಮಾಡಬೇಕಂತ. You can use niacinamide one time, vitamin C the other. ಒಂದು ಬೆಳಗ್ಗೆ ಹಾಕಿದರೆ ಇನ್ನೊಂದು ರಾತ್ರಿ ಹಾಕ್ಬೋದು. It hydrates the skin, brightens the skin. It works on some pigmentation. It's a good product. Niacinamide also will in that category of the first three that you mentioned. Niacinamide is a close fourth.
Okay.
Yes.
Next to glycolic acid.
Glycolic is alpha hydroxy acid.
ಅಂದರೆ
H and acids. It's essentially a fruit origin. So all AHAs you will extract from different fruit and plant sources, and it's a subtle exfoliating agent. ಅದಕ್ಕೆ chemical peels ಅಂತ clinics ಅಲ್ಲಿ ಮಾಡಿದವಾಗ most chemical peels will contain an alpha hydroxy acid. Glycolic
acid
is the best example. There are others, but this is the best example of an alpha hydroxy acid.
So this is basically an acid which is mostly part of the peel, not part of the creams.
No, also part of the creams.
Yeah?
So yes, because creams ಏನಾಗುತ್ತೆ ಅಂದರೆ glycolic acid, other than being an exfoliant, it also has the ability to synthesize new collagen. So it's a collagen booster.
So ಇದು okay.
It also improves hydration. It helps pigmentary changes. It is anti-aging also. Yes.
ಮುಂದೆ salicylic acid.
Salicylic acid is what's called a beta hydroxy acid. The alpha andre adu beta. Salicylic acid is best used in the context of acne. So younger adolescent skin, young adult skin, acne prone skin. So it penetrates the oil gland or the oil gland tissue better. Declogs the pores.
So that it prevents the area from acne.
It helps treat acne and has some preventive role to play as well.
Now, the biggest trend, the snail mucin. ಏನು ಡಾಕ್ಟರ್ ಇದು ಯಾವ್ಯಾವುದೋ ಏನೇನೋ ಟ್ರೆಂಡು.
ಹೌದು, ಐ ಥಿಂಕ್ ಹೇಳಿದ್ನಲ್ಲ, ಅಲ್ಟಿಮೇಟ್ಲಿ ಯು ಹ್ಯಾವ್ ಟು ಟೇಕ್ ಇಟ್ ಇನ್ ಕಾಂಟೆಕ್ಸ್ಟ್.
ಏನಿದು ಸ್ನೇಲ್ ಮ್ಯೂಸಿನ್ ಅಂದರೆ?
It's basically a product that comes out of Korea, and as the name suggests, yes, it replicates the mucin, the mucinous substance that the snail produces. It is not necessary that you extract it from the snail and put it in a bottle, which could be done. Or you synthesize a product or replicate it closely. So you have a snail mucin-like product, which ultimately is again for hydration, the same thing. So looking at it from it's what hyaluronic acid would be doing. Or
is it here to stay or is it just a fad?
I think some of them would have to be considered to be fads. Because people who did not use snail mucin or can't complain and say the skin isn't good because they didn't use snail mucin. And the ones who are using it is as good as not using another different kind of a moisturizer.
So what ಇತ್ತೀಚೆಗೆ ನೀವು ನೋಡಿದ್ರೆ ಸ್ಕಿನ್ ಟ್ರೆಂಡ್ಸು ಕೇರ್ ಇದೆಲ್ಲ ತುಂಬ ಕೊರಿಯಾ, ಜಪಾನ್ ಈ ಕಡೆಯಿಂದ ಬರ್ತಾ ಇದೆ. ಸೊ ಇಷ್ಟು ದಿವಸ ಇಂಡಿಯಾಗೆ ವೆಸ್ಟಿಂದ ಒಂದಷ್ಟು ಕಲ್ಚರಲ್ ಇನ್ಫ್ಲೂಯೆನ್ಸಸ್ ಬಂದರೆ ಸ್ಕಿನ್ ಅಂತ ಬಂದ ತಕ್ಷಣ ಸಡನ್ಲಿ ದ ವರ್ಲ್ಡ್ ಇಸ್ ಲುಕಿಂಗ್ ಟುವರ್ಡ್ಸ್ ಈಸ್ಟ್. ಸೊ who drives the wave? What is happening there?
Korea is definitely the numero uno in Asia. And of course, world allo, just like their cars and televisions, they have a prime place.
For skincare.
For skincare, for sure. One cannot ignore it. They are driven by science and they are... Ali yenagide andre aesthetics and cosmetology has penetrated very deeply.
Like?
It's almost like a way of life. It's not like you'll have the occasional person walking into a clinic for some kind of treatment. You can say that a majority of Koreans have had some treatment or the other. Adolescents and above.
Why do they give so much importance, doctor?
I think it's also culturally driven, social media driven, just like here, and so on. So, a penetration is quite significant. In India, if you say the awareness or people actually seeking treatments, maybe a fraction of a percent or less, only probably 7 out of 10 people would have had something done. So it has become, it's a fine-tuned industry. Home products irli, treatments irli, they are good. You cannot just discount. ಮೊದಲಿತ್ತು more ಕೊರಿಯಾದಲ್ಲಿ, ಈಗ now they're exporting it to the world.
Yes, so the window is open so that the world can take reference from it and all.
And haudu, and they have penetrated the West as well.
ಅಲ್ಲಿದು ಯಾವ ಒಂದಷ್ಟು ಇಲ್ಲಿಗೆ ಇನ್ನೂ ಬರೋದು ಬಾಕಿ ಇದೆ, which is something that can surprise our audience today?
I wouldn't say there's anything like that. Stem cell based treatments, and the stem cells, whether plant derived or human derived or of other sources, are cells that have the ability to, for example, do all the things that we would like for skin regeneration or rejuvenation. So stem cell based treatments or stem cell based creams ide, but adu ide, it's not very new. Adu it comes from the West, comes from Korea, adide. But I think at this point, you could say we're very saturated. Quite saturated.
One more, longevity clinics another is a trend today. Hormones, like all your biggies of the world, like the Elon Musk's, some we hear, hormones, replenish ಮಾಡಿಸ್ಕೊಂಡ್ರು, ಅಥವಾ antioxidants infuse ಮಾಡಿಸ್ಕೊಂಡ್ರು. Can you throw some light on all these things? Is it related to dermatology as well to increase the longevity of their ido?
It's a very important thing, because ನೀವು traditionally medicine ನೋಡಿದ್ರೆ, it was geared only to treat illness. You'd never go visit a center if you were well.
Alva?
Howdu.
Wellness is a new category.
It's a new category that has grown by leaps and bounds recently. ಅದು ಈಗ ಏನಾಗಿದೆ, financially stable, good lifestyle, everything is set. What is next? Improving quality of life indices. And longevity, maybe to a point which we could not have imagined in the past. Yakandre, it is believed that as we speak now, across the planet, there have been there are humans who will live to be not 100, which is no big deal, but could be anywhere between 120 and 150.
Oh.
Yes. Adರಲ್ಲಿ science has come to that point. So yes, ನಿಮಗೆ ಒಂದು 3D printed organ ಇರ್ಬೋದು in the future, ಒಂದು bionic arm ಇರ್ಬೋದು, other implants ಇರ್ಬೋದು, but longevity in terms of chronology, 120, 150 is a possibility for humans in the near future.
Amazing. So what part of it is directly touching the derma and your skin industry?
I think it should be a holistic approach. I think idರಲ್ಲಿ longevityಯಲ್ಲಿ, everything else being equal, the diet plays a very, very important role.
Andre?
Diet alli, the kind of diet that we follow, the longevity diet, often they say it's the Mediterranean diet or the Okinawa diet. So Japanese. So they definitely aid in longevity. What we eat is what dictates how long we live also. Illandre, you eat what you shouldn't be eating, and you might have everything else, but it could shorten your lifespan.
The more is less. Less is more. Another idರಲ್ಲಿ.
Absolutely. Less is more. Because when you don't consume too many calories, in fact, these calorie restricted diets are known to enhance longevity.
Wow.
But ಏನಾಗಿದೆ ಅಂದರೆ humans ಈಗ we eat for recreation, not for other things. We're eating half a dozen times a day and snacking in between. There's no time anymore. So ಅದಕ್ಕೆ all those new diets that come in and the intermittent fasting, they all have a place, because we can definitely afford not to consume the calories we normally do. So diet is important. But then you talked of infusions, correct. Various antioxidant infusions, could be glutathione, coenzyme Q10, and so on. They aid in improving cellular function.
That's controversial, Liga. Please, where do you stand, sir? Some say glutathione is very good. Some say bad, unnecessary. And yarigadu?
See, glutathione is the prime example of a molecule. Normal namdu glutathione is produced internally. It's not that bari now externally takondre matra adu nam body sigate anta. In the context of illness, bekantilla. Now we have put illness aside. Now we are talking wellness. In that context, it makes a difference.
So saying it's required for wellness.
It is required for wellness. It may have an impact on illness as well, but that's not. There is data, but it's not something a lot of companies are going to invest in heavily to fix. Because illness is a completely different category. In the context of wellness, yes, it might help not just the skin, but might delay, not treat or prevent, but delay Alzheimer's or dementia. It has a role to play.
What is the Indian medicine saying? Adu FDI approved illa ansate innu?
No.
Yake?
Andre ultimately all of idella data beku. Data ilde approvals barlik agalla.
So what are they waiting for, and how much long will it take for India to accept this officially?
Data costs money. Somebody's got to invest in that data. So that point hasn't arrived.
If
you have data, where does the data come from? Trials. How do trials happen? Human trials. You need multi-centric trials, multi-continent trials. It calls for a lot of money.
And you need somebody to call the shots and then control all of this.
Correct. Ultimately, data pharmacy elin barate from the pharma company. They invest a lot of money and then they recuperate or recoup it with time through sales. Now, a pharma company typically is not going to invest in glutathione to prevent illness.
It's a double-edged sword.
Absolutely. For example, if you want graying, there's a lot of research on graying, premature graying, happening in universities, in animal models, alli. Data intermittently barta irutte. But why would you want to prevent graying when coloring it is a bigger industry?
Lobbying.
Also happens. The money, it's ultimately where the money goes. Preventing graying is less enticing than trying to fix it later.
Wow. At times ಇವೆಲ್ಲ ಕೇಳಾಗ ಏನನ್ಸತ್ತೆ ನಾವೊಂಥರ ಬಾವಿನಲ್ಲಿರೋ ಕಪ್ಪೆಗಳು ಅಷ್ಟೇ ಇದ್ಕೊಂಡು ಇಷ್ಟೇ ನಮ್ಮ ಪ್ರಪಂಚ, ಇದೇನು ಹಂಗೆ ಮೆಡಿಸಿನ್ ಕೊಟ್ಟಿದ್ದಾರೆ, ಇದೇನಿದೆ ಇದಿಷ್ಟೇ ರೈಟು, ಇದಕ್ಕಿನ್ನೂ ಸ್ಟಡಿ ಇಲ್ಲ ಅಂತ. ಬಟ್ ವಿಚ್ ಇಸ್ ನಾಟ್ ದ ಕೇಸ್ ಅಂತ.
ಸಮಟೈಮ್ಸ್ ಅದಕ್ಕೆ ಸೊ ಆಲ್ ದೀಸ್ ನೀವು ಗ್ಲೂಟಥಿಯೋನ್ ಇರಲಿ, so it's not an absolute that our world revolves around glutathione. Yes, it is available. It is a tool. In the right context, it has its role to play.
Now I'll take you through certain Korean skincare routines. You tell me what makes sense to Indian skin, what doesn't. Anta. Modanedagi face yoga.
I'm not sure of this face yoga. I'm not a...
You don't
I do not, because one, though we are saying we are going to use Botox for what? Overexpression or hyper-expression. All the lines yellin barate, not because necessarily because of aging. We recruit these muscles more, produce more lines in the skin. Yak heli? On the face, all the muscles of facial expression are attached to the skin, unlike elsewhere. You can't express on your forearm. So, you're creasing the skin. Correct. Absolutely. So that's how we express and understand what the other person's feeling or conveying. Now, adan takondu iga face yoga madidre, nothing wrong with face yoga. But if you say, I don't want fine lines and wrinkles induced by muscle contraction, then why would you want yoga? That is from an aesthetic perspective. Now, if you say face yoga helps in blood circulation, this, that, I say fine, be happy. Nothing wrong with it.
So you're saying every exercise or every find has a byproduct, like 2-3. Now you need to pick why yavudakke ಮಾಡ್ತಾ ಇದೆಯಾ, which byproduct are you okay to live with.
Correct.
Face massager ಅಥವಾ ಇದೆಲ್ಲ ಬಂತಲ್ಲ ಯಾವುದು Onyx.
Yes, all of those. all fads. Yes. I mean, is massaging the face a good thing? Probably. At least you feel nice if you did that. Sometimes just feeling nice is an important element. It heals you. It calms your mind. So all of these things, if they achieve that for you, you can't argue with it.
So you can't sculpt your face?
No. I wish that could happen. You do this and the skin goes in that direction. It doesn't work.
It's not cement, it is skin.
Absolutely.
Munde, toner pad is one fad today. Are you a fan of it?
No, I'm not.
Why?
Neutral, meaning precisely.
Toner
is supposed to tighten your pores. So in any routine you would know. People will talk of a cleanser. You would
CTM.
Absolutely. You will tone the skin and then use a moisturizer and a block and so on. But the role of a toner, strictly in terms of proven effects, carries the least convincing data compared to the cleanser, the moisturizer and the sunblock. So the toner, if it's in your routine, fine, nothing wrong with it. Might act as a mild astringent, tightens your pores. Nothing wrong if you used a toner. So, yeah.
All right. Matte probiotics in skincare, adondu hosad bannide. Ade panthenol tarane idu jotege.
Haudu. Probiotics, of course, we all know probiotics taken internally to alter them. Absolutely. The gut microbiome. The skin microbiome, of course, we carry 1 trillion organisms on our skin. So you use live organisms in a cream formulation, which improves hydration, reduces inflammation, and so on. But I'm not sure that, other than specific contexts, I'm not sure that a probiotic cream needs to be an essential part of somebody's routine. Not as yet.
One question, idellatra madhya baradu. One A for Apple ittu prapanchadalli modlu. Today there are like hundreds of creams available. Honestly, eshtu layers of cream can the skin actually absorb?
This whole layering process.
Multi
skincare. Yes. I think sometimes we need to draw the line somewhere. Neevu helidralla, more is less and less is more. In terms of this daily routine, more has become less. The more and more and more you feel is not enough. One more. You read another product and you then layer that on top. I think sometimes we need to deconstruct some of these things. And like I said in the beginning, you don't need to do too much to the skin. Yes, your diet is important. Cleansing, obviously. Hydration when needed. Sunblocking also most of the times. Ast madidre, your skin will look after itself. Adding to this, now you say we want to move it a couple of notches. Yes, introduce a product like a vitamin C, a hyaluronic acid, a night retinol serum or cream, niacinamide. But it does not mean you need to have 4 in the morning and 4 in the evening. I think keep it simple. Choose 2 actives. One the ಬೆಳಗ್ಗೆ, one the ಸಾಯಂಕಾಲ. ಬೆಳಗ್ಗೆ have no time, just rotate it at night. One night this and one night that.
Active andre ella vitamin C, hyaluronic, retinol.
Yes.
Collagen, again, it's a drink, so it's not a cream.
No.
Niacinamide,
yes.
glycolic ಮತ್ತೆ salicylic.
So ಈ ಥರ ಇಷ್ಟು ನೀವು ಮೆನ್ಷನ್ ಮಾಡಿದ್ರಲ್ಲ, I think generally, unless the skin was of a certain kind, you could leave out the salicylic and the glycolic. ಅವಾಗ ಏನು ಮಾಡ್ತೀರಾ? You can use the vitamin C in the morning, retinol at night. Younger skin, use niacinamide once, vitamin C once. Or skin is generally good, just use niacinamide and hyaluronic acid. But it's not necessary that you run all 4 at the same time.
Correct. One more idu, all the billing counters today, ಈ ಚಾಕ್ಲೇಟ್ ಐಟಂಗೆ ಮಾಸ್ಕ್ ಶೀಟ್ಸ್ ಇಟ್ಟಿರ್ತಾರಲ್ಲ, ನೀವು ಅದ್ರ ಫ್ಯಾನ್ ವರ್ಕ್ ಆಗತ್ತಾ? ಮಾಸ್ಕ್ ಶೀಟ್ಸ್ ಏನು ಮಾಡುತ್ತೆ? ಗ್ರೀನ್ ಟೀ ಅಂತೆ, ಚಾಕ್ಲೇಟ್ ಅಂತೆ.
See, sometimes now we use masks in the clinic. ಅವಾಗೇನು post procedure, active procedure ಆಗಿರುತ್ತೆ. Then just as a calming agent, we may use a mask. Sometimes a sheet mask, sometimes a clay mask, sometimes other masks. But a mask ಎಷ್ಟೇ ಇಂಗ್ರೀಡಿಯೆಂಟ್ಸ್ ಹಾಕಿದ್ರು ದಿಸ್ ಲಿಮಿಟೆಡ್ ಪೆನಿಟ್ರೇಷನ್ ಇನ್ ಟು ದ ಸ್ಕಿನ್. ಸೊ ಮೇನ್ಲಿ ಇದು ಏನು ಮಾಡುತ್ತೆ ಅಂದರೆ ಇಟ್ ಹೈಡ್ರೇಟ್ಸ್. ಇಟ್ಸ್ ಅ ಹೈಡ್ರೇಟಿಂಗ್ ಮಾಸ್ಕ್ ಮೋಸ್ಟ್ಲಿ. ಮೇ ಬಿ ಸಮ್ ಬ್ರೈಟನಿಂಗ್ ಮಾಸ್ಕ್, ಸಮ್ ಆಕ್ಟಿವ್ಸ್, ಆರ್ಬ್ಯೂಟಿನ್ ಇರುತ್ತೆ, ಕೋಜಿಕ್ ಆ್ಯಸಿಡ್ ಇರುತ್ತೆ, ಸಮ್ ಬ್ರೈಟನಿಂಗ್.
ಸ್ನ್ಯಾಕಿಂಗ್ ಫಾರ್ ದ ಸ್ಕಿನ್.
ಸ್ನ್ಯಾಕಿಂಗ್ ಫಾರ್ ದ ಸ್ಕಿನ್, ನೀವು ಕರೆಕ್ಟ್ ಟರ್ಮ್ ಯೂಸ್ ಮಾಡಿದ್ರಿ. ಸೊ ಯು ವಿಲ್, ಇಫ್ ಯು ಹ್ಯಾವೆಂಟ್ ಯೂಸ್ಡ್ ಒನ್, ಯು ಆರ್ ನಾಟ್ ಮಿಸ್ಸಿಂಗ್ ಮಚ್. ಯೂಸ್ ಮಾಡಿದರೆ ಇಟ್ ಮೇಕ್ಸ್ ಯು ಫೀಲ್ ಹ್ಯಾಪಿಯರ್. ಗುಡ್.
Okay, so we covered how many skin creams to apply. Night routine, ಇದು ಯಾವ ಏಜಿಂದ ಶುರು ಮಾಡಬೇಕು?
I think interesting observation, and ನಮ್ಮ ಕಾಲೀಗ್ಸು ಅದೇ ಹೇಳ್ಬೋದು. ಮೊದಲು typically we had the 28-29-year-old saying, Doc, I'm turning 30 soon. When should I start my retinol or whatever? Now, although it has moved a decade, and you'll have the 19-year-old saying the same thing and saying, I'm going to be 20 soon, when should I start my routine? And also mention retinol. And then ಈಗೇನಾಗ್ತಾಯಿದೆ ಅಂದರೆ it's like a sliding ruler that is moving into early adolescence. The adolescent also is apparently asking in the West, but the young adolescent, and talking of all the creams you just mentioned, but who will send the mother and say, please go see the doctor and ask him for this. So the mother shows up and say, my daughter was 13, sent me, and she said to inquire about this. So the level of penetration of information is just getting to the youngest or younger population.
And I'm sure they don't have the right knowledge to handle these things and curiosities at that age.
Houdu, because data is so much. The only thing available in plenty is data, information, which is an overload at times. Because ನೀವು ಡೇಟಾ ನೋಡಿದರೆ any condition you want to go and Google, first thing you'll also always hear the worst first. Even for the most routine things, you'll have the most sinister things coming first. So processing data is the challenge. So coming back to your question, when do you start a routine or an anti-aging, a night routine? I think in your early 30s or late 20s.
ಮತ್ತೆ ಅದು ಕೊನೆವರೆಗೂ ಕಂಟಿನ್ಯೂ ಆಗಬೇಕದು?
Not necessarily, but it will change in some form or the other and continue long term. No harm in applying a cream in a pot.
ಸೊ ಇನ್ಕ್ಲೂಡಿಂಗ್ ಪ್ರೊಫೆಷನಲ್ಸ್ ಲೈಕ್ ಮೀ, ಮೊದಲು ನಾನು ಆರ್ಜೆನೇ ಅಷ್ಟೇ ಆರ್ಜೆಯಿಂಗ್ ಆದಾಗ ನಾನು ಏನೊಂದು ಶಾರ್ಟ್ಸ್ ಹಾಕೊಂಡು ಕೂತ್ಕೊಂಡ್ರೆ ಮೈಕ್ ಮುಂದೆ ಮೈಕ್ ಇಸ್ ಅ ಮೇಕಪ್, ಐ ಆಮ್ ಜಸ್ಟ್ ಇದು. ಬಟ್ ನಾವು ಐ ಆಮ್ ಇನ್ ಫ್ರಂಟ್ ಆಫ್ ಕ್ಯಾಮ್ರಾ, ಯೂಸ್ ಮೇಕಪ್ ಪ್ರಾಡಕ್ಟ್ಸು, ಬ್ರಷಸ್ಸು, ಅಲ್ಲಿ ಒಂದಷ್ಟು ಮಿತ್ಸ್ ಇದೆ. ವಿ ಆಲ್ವೇಸ್ ಮೇಕ್ ದ ಪ್ರಾಡಕ್ಟ್ ದ ಫೂಲ್, ಅಥವಾ ಗೂಬೆ ಅದ್ರ ಮೇಲೆ ಕೂಡಿಸ್ತೀವಿ. ಸೊ ವೇರ್ ಇಸ್ ದ ಪ್ರಾಬ್ಲಮ್? ಸಮ್ವೇರ್ ಐ ರೆಡ್ ಇಟ್ಸ್ ಯೂಶ್ವಲಿ ದ ಬ್ರಷಸ್ ಆ್ಯಂಡ್ ದ ಇದು ಅಪ್ಲಿಕೇಟರ್ಸ್ ವೇರ್ ದ ಬ್ಯಾಕ್ಟೀರಿಯಾ ಕರೆಕ್ಟಾಗಿ ಯೂಸ್ ಮಾಡಿದೆ, that will eventually lead to skin problems. So in your experience, doc, makeup and skincare, how to simplify this?
I think see, one can't wish away makeup. It's so integral, in a studio setting, in front of a camera, or at the workplace. So one can't say no makeup, doesn't make sense. Unless you choose it as a individual choice. So then picking the right makeup ingredients from the best manufacturers makes sense. Because generally, if your skin is okay, it doesn't matter which brand you used, honestly. But if you have problem skin or problematic skin, then you want to look at the fine lines. You want to look at the very best. And then you need to look around and see who makes the very best. And if the very best doesn't agree with you, unfortunately, you need to give up. Change or not use them at all.
Got it. Because we all have this mentality, if it is expensive, it means to say it is good. So I will definitely take few luxury skincare brands and also the mass brands, okay? ಅಂದರೆ ಇವತ್ತು ಸಮಾಜ ಹೇಗಿದೆ ಅಂದರೆ there is one Mama Earth which is also giving us a face cream for probably 200-300 rupees. At the same time, here we have brands like Cetaphil, we have Aveen, The Ordinary ಇದೆ, CeraVe ಇದೆ, Neutrogena ಇದೆ, Murad ಇದೆ, Bioderma ಇದೆ. So these are all brands that I am aware of because Bioderma, Murad is something that I swear by. ಯಾಕೆ? Of course, started with people like you and the clinic suggesting me this. ಟ್ರೈ ಮಾಡಿದೆ, ವರ್ಕ್ ಆಯಿತು, ಅದನ್ನೇ ನಾನು ಆಟ ಆಡೋಕ್ಕೆ ಹೋಗಿಲ್ಲ ಅದ್ರ ಜೊತೆಗೆ. ಬಟ್ ಫಾರ್ ದ ಮಾಸಸ್, ಈಗ ನಾನೊಂದು ಮುರಾಡ್ ಚೆನ್ನಾಗಿದೆ ಅಂದ ತಕ್ಷಣ ಸಂಬಡಿ ಶುಡಂಟ್ ಬ್ಲೈಂಡ್ಲಿ ಗೋ ಆ್ಯಂಡ್ ಯೂಸ್ ಇಟ್ ಅಲ್ವಾ? So what is your observation when it comes to like Mamaearth ide, ee kade mass brand andre Vaseline ide, Olay, right?
Olay.
Yeah. So yeah. So how do we look at choosing the right brand? Is it the cost or what is the the formula behind? So
sometimes formulations are important. Not all vitamin C's are the same. You sometimes note vitamin C is being marketed online by somebody who's making it at home. Sometimes, and then at the other end, you see large pharma companies who have not been able to stabilize vitamin C well. So just because I claim to have my own vitamin C doesn't mean it works. So there is science behind putting a product on the shelf. And the better equipped companies probably have better R&D facilities to produce a more stable product that works longer and better. Definitely, without a shadow of doubt. So in that context again, it also makes it more expensive when you also pump in more money to get the best ingredients and the best product. So that, I think, is the bottom line. But doesn't necessarily mean that the most expensive is necessarily the best. Always the best. But generally, by and far, I think that's the best paradigm of things, isn't it? To judge. How do you judge unless you've checked it, run it through a research lab or a lab that is able to deconstruct these products and tell us just how good or bad they are? It becomes difficult. And also, now in today's world, with social media and everything, and it's dominated by influencers, it's very difficult to be objective. We're living in a very subjective world. So to look at something objectively is becoming a challenge.
So how do we look at it objectively, like without getting distracted, without andre ade influencers doctors agbididaare ivattu
haudu. So then what happens is when you start buying products based on data that you've looked at online, and then you choose a product, you might choose a product that is less expensive because it suits your budget and you think it works. Ultimately, in the world of cosmeceuticals, and all of these belong in the world of cosmeceuticals, which is different from the pharmaceutical world. The difference being cosmeceutical products are not subject to rigorous both selection and, shall we say, data-driven processes as the pharmaceutical product is.
Correct.
Pharma needs data, evidence, and a whole lot of extremely critical and strict set of procedures and rules. Cosmeceutical, you can make claims with very little data. So that's the issue. Therefore, sometimes you think cosmeceutical products, whether they work or don't work, doesn't matter too much. If you like the texture and you like the smell and you're happy applying it, who's to argue with that?
Wow.
Yes. I also wanted to interrupt because you raised the important question of sunblocks, and then I think we took a deviation. Sunblock use indoors, indoors hakbeka hege anta. I think sometimes again we have to be practical. Sunblock hakidre, on an average, most sunblocks work for about 2 hours or 2.25.
Correct.
Adike, you need to apply the right amount.
What is the right amount?
Right amount is typically about 2 milligrams per square centimeter of skin, which is nobody measures and it becomes a challenge again. And more importantly, the fact that you need to apply it often.
ಬೆಳಗ್ಗೆ ಹಾಕೊಂಡು
ಹೌದು, ಮೋಸ್ಟ್ ಪೀಪಲ್ ಸನ್ಬ್ಲಾಕ್ ಹಾಕ್ತೀರಾ ಕೇಳಿದರೆ ಹೌದು ಅಂತ ಹೇಳ್ತಾರೆ. ಬೆಳಗ್ಗೆ ಹಾಕಿರ್ತಾರೆ and that's it. It's not practical at all. The use of sunblocks, in my opinion, is the least practical of everything. I'm saying repeat every 2 hours. How is that possible?
ನೀರು ಕುಡಿಯೋಕೆ ರಿಮೈಂಡರ್ ಇಟ್ಕೋತೀವಿ.
ಹೌದು. So I think one has to focus on outdoor exposure and indoor for you. Yes. Otherwise, for an average Indian living at home and you don't have light coming through the ceiling or through large windows, you don't need to. Unless you were very light sensitive, that's a different category. So you have blue light filters today from your PDAs and others. You have UV light from other sources. So focus on sunlight. And for the sun, use a block with an adequate SPF of anywhere between 30 and 50. Use it often enough when needed and in adequate amounts so that covers your skin adequately. ಇಲ್ಲಾಂದರೆ ಕಮ್ಮಿ ಹಾಕಿದರೆ ಏನಾಗುತ್ತೆ ಅಂದರೆ SPF 50 ಬಂದು SPF 25 ಆಗಿಬಿಡುತ್ತೆ. So that's the advantage of using a higher SPF. Honestly speaking, SPF 15 ಸಾಕು. But SPF 15 ಹಾಕಿದರೆ ಕಮ್ಮಿ ಆದರೆ 7ಗೆ ಬಂತು.
Effectiveness is
half. ನೀವು 50 ಹಾಕಿದರೆ 25ಗೆ ಬರುತ್ತೆ. 30 ಹಾಕಿದ್ರು 15ಗೆ ಬರುತ್ತೆ, which is still fine. So that's the advantage. And then physical blocks, that's a different world altogether. But the use of sunblocks is important, mainly because if nothing else, it may delay photo aging in the long run.
So now, can you help us address some of the elephant of the room topics? Andre, dermatology is definitely word of mouth. So the trust that you've built over ages through word of mouth and through your body of work, there are also cases which always puts you like in a sandwich. Udaharanege, getting under the knife. That's always the elephant of the room. Lip job ante, body sculpting. These are all things that always happens like shh. So tell us about who needs this. What is the reality of these? And also there was a research apparently which I was just reading, especially after the knife, after the plastic surgery, 50 to 60% of them might go through depression because of the outcome. They don't know, they are not happy, ಏನೇನೋ ಸ್ಟಡೀಸ್ ಎಲ್ಲ ಇದೆಯಲ್ಲ, ಇದೆಲ್ಲದ್ರ ಮಧ್ಯ Dr. Shetty, sir, please tell us the reality.
Surgery or cosmetic surgery has an important place. Because certain circumstances irutte, ನೀವು ಏನು ಮಾಡಿದ್ರು you cannot get the outcomes. And so going under the knife for certain indications in certain circumstances is probably the only way you can fix an issue. And sometimes it is less expensive than the temporary issues that you need to do more often. For example, we do a lot of chin implants using a filler, which works very well instantly, but needs to be redone in about a year or a year and a half, for example. If you actually placed an implant in that area, which is permanent, in the long run it's less expensive than the filler. One. Some say you want to reduce fat around the midriff. You've done everything, you have an active lifestyle, you're exercising regularly, you've lost weight. However, this seems to be not responsive, which a lot of people will tell you. Avaga, you can look at body contouring or sculpting using non-surgical methods. Adu sumaragide, many technologies, from freezing the fat
ice sculpting.
Ice sculpting ide. You can have a fire and ice model where you
heat. What is that? Can you explain, sir?
Of course. Cool sculpting or ice sculpting is freezing fat. So you can freeze it to minus 8 or 10 degrees.
How do you do that?
There's a device with an applicator. Although it will grab the amount of fat that needs to be targeted and freeze it for a given length of time. The ice crystals that you produce causes fat cell necrosis or damage, and actually leads to permanent fat reduction in that area treated. So it's a good treatment when you're targeting small amounts of fat, either in spot reduction in the double chin area, the arms or the abdomen.
So will it come back?
The fat that is taken away will not come back, but the existing fat cells around it, if your lifestyle is not good, meaning you do not exercise or you don't follow a decent diet, could increase in size and occupy the same space.
ಮತ್ತೆ ಇದೇ ಇದರಲ್ಲಿ ಸ್ಕಿನ್ ಸ್ಯಾಗ್ ಆಗುತ್ತೆ ಅವೆಲ್ಲ ಇದೆಯಾ?
ಇಲ್ಲ, sometimes it depends on what procedure. So usually ಸ್ವಲ್ಪ skin contraction ಆಗುತ್ತೆ when you do this. So sagging usually ಆಗಲ್ಲ, and so that is freezing the fat. Fat can also be melted using radio frequency, high intensity focused ultrasound. You can melt it using laser, and sometimes a combination of all of these. So you combine the heating methods to the freezing methods to get the best outcomes. However, sometimes that's not enough. Avaga, you might want to go under the knife. So knife is still the gold standard. With all these methods that I talked about are supposed to be substitutes for the knife, which is applicable to most people.
Like oral medication before the surgery tara.
Haudu. Idralle, if our requirement is met, we're happy with this. Like that. Haudu.
Curious to know about tumba lip job, nose job. How expensive are these, doctor? Like give us a number, like average cost.
See, if you say a lip job typically is a filler-based thing. Only filler, it's not surgical. Unless you inject a filler. And you get almost instant results. Good results that stay for 6 to 9 months or longer. And the typical cost of that would be somewhere around 25 to 30,000 rupees for a lip filler. If you did a nose job, you could also use a filler there, but a nose job primarily reflects a surgical intervention. The procedure may cost anywhere from 75,000 to $1.5 lakh, depending on what is done, which is more permanent.
Why? How is that plastic surgery nal mado surgical invasions? Normal surgery tara ashti eddu kaanalla. How, doctor?
Because the incisions are not made from the outside, they approach the nose from the inside. Unless you're doing a nose reduction, you might have the scar, but it is hidden well in the corner of the nose, so it doesn't show.
Interesting.
I want to go back to another question you asked about plastic surgery, and you said, why are people unhappy?
Yes.
And you said you quoted some data.
Right.
That is because, and you obviously heard of celebrities who go to the very best names on the planet, right? And how come they are unhappy, or why have they gone through multiple procedures if they've gone to the very best? Also, part of the problem is patient selection. Or
doctor selection? No, patient selection.
Patient selection. Meaning, there's an entity called BDD, called body dysmorphophobia. We are perpetually unhappy with our looks or with some aspect of our being. So BDD is a common entity that many patients who come forward for cosmetic procedures suffer from. So they're always unhappy. So you correct the nose 4 times, they're still unhappy. And I don't have to take names, of people in the industry who've had that done.
So how do you handle them?
Very difficult. Sometimes saying no is the answer. Because whatever you do, they're still unhappy. And you might have read of extreme cases. They've done every possible procedure under the available and still unhappy. So body BDD is a concerning entity. So when you see a cosmetic patient, it's a disorder. So when you see a patient coming for a cosmetic procedure, you need to screen for BDD first.
Our mentality hege.
Yes. And it's better to say no in the beginning than say yes and create a very unhappy patient who then seeks multiple redressals to fix the problem, which probably doesn't exist.
So dermatology...
It is called the distress of imagined ugliness.
Distress of the imagined ugliness. Tara narcissism do one of the byproduct ansathism. Yes. Okay. Doc, I know over the years, high profiles in handle madodu to every normal janasamanirna handle madodu. What is a bridge, and then what is that power that you have? It's always a responsibility reminding you of something.
See, one ಒಳ್ಳೆದಂದ್ರೆ celebrities, as you speak of them, they're essentially by and large nice people, and being celebrities, they do not throw their weight around. That has been my experience. They've been as down to earth as one could possibly be, and they have their minor concerns, and which you address with a prescription or with something very simple. So that has been my experience. It's never been a challenge, whether you have a major celebrity status or you're the quintessential housewife. I think it's as humans, they have always come across being good. So I can't really think that we have to be very different as long as you understand what they seek and deliver it in the best possible manner. So it's not been a challenge.
Okay. Any post-operative letdown wins that you yochne ಮಾಡ್ತೀರಾ today, because every profession's ride ups and downs irutte.
Nodi, when you treat a large number of people, invariably there will be times when the outcomes have not been the best. If somebody says nangenu agela, I have had 0% failure, then it just means you haven't treated enough people. So that is true of anybody in any specialty, any organ system, whether it's the skin or the heart or wherever. Having said that, it is important to go into why that did not happen, or what could have been done better, or if everything was done, why did they not respond adequately? So you need to analyze that. It happens. Not everybody will respond to everything. 100 preceding people would have responded exceptionally well, and this current patient or client hasn't. It is true, whether it's illness or wellness. Absolutely.
Occupational hazard, the stress that you also go through when the desired result is not met.
Yeah, in that context, it's very important to handhold through this, whether it's a crisis or a marginal case of whatever. You need to handhold them. Empathize. Empathy is the most important thing.
So, last few questions. Hasty measures people take to turn age back, that you would like to address.
I think the only quickest method of now we just talked to the face. Of course, face and the neck and the back of the hands. But face. Botox is wonderful because it works in 3 days. 3.5, 4 days, you start seeing results. In the upper third of the face, there is no molecule better than Botox.
Including me, I am really
so it's a protein produced by a bacteria that is purified. We reconstitute it and inject it into the muscle, which basically relaxes the muscle. Because the muscle is relaxed, it relaxes the skin, which relaxes the line. In about 3 to 6 months, that effect is reversed. It goes back to where it would otherwise have been. And if you retreat it, it remains relaxed again.
It doesn't take it further downhill?
No.
Like once maadi bitre matte hanga goyitu? No.
It'll go back to what it would otherwise have been. And it's really it's a product that people love to hate. And anything you see that's gone wrong on anybody's face across the planet, they'll first blame it on Botox. And most of the time, it's not the Botox.
What is
nothing. Botox almost never goes wrong. If it did, it auto self-corrects after a few weeks. Yes, you don't have to do anything. So Botox, no. It's usually, if it's a badly done job, it's the filler, not the Botox.
Filler ಅಂದ್ರೆ usually kan
ಕೆಳಗಡೆ cheeks ಮೇಲೆ, chin ಮೇಲೆ, lips ಮೇಲೆ.
What is Botox? And filler ku Botox ku difference ಏನು doctor?
Filler is, like I said, essentially consists of hyaluronic acid. There are permanent, semi-permanent fillers. Permanent fillers are not a good product to use because that longevity that you think is good on the pocket may produce problems in the long term. So it's usually 95% of all fillers used across the globe are hyaluronic based. HA fillers are wonderful, provided you do it in the right amounts, in the right context. It is eventually broken down to carbon dioxide and water.
So you don't have to
need to
address madoshu.
However, let us say you put some hyaluronic acid into tissue and now suddenly next morning you don't want it. You can dissolve it in a matter of minutes. Yes, you can melt it with another injection.
Interesting. So these are all the measures that people might take to turn age back.
And of course you have Botox, which is a commonly done thing, fillers, and we talked about lasers and peels and the rest.
Laser ಬಗ್ಗೆ ಹೇಳಿ doc, because we didn't speak much about you being an aesthetic laser physician. What kind of
the laser is a wonderful tool and extremely specific to what it's supposed to do. For example, laser hair reduction, which is so commonly done now, has a target chromophore that absorbs the laser energy, which is melanin in the hair. So it does that. You want to target another tissue where the chromophore is water. For example, you're treating scars, use a different laser. You're trying to lighten pigment, you use a laser that targets the pigment in the skin. And supposing there's a vascular issue, targets oxyhemoglobin. So depending on your target, you choose the laser and the indication that it can be used for.
Yes. One advice for people wanting to pursue a career in dermatology.
That's a very good and interesting question, because when I graduated in 1990, 88, 90, then 93, the MD, aesthetics did not exist as a specialty or subspecialty. It was dermatology. So we were all, and still are, dermatologists first. And then, of course, as into the current century, in early 2000, aesthetics started to creep in to the practice. And today, like I said in the beginning, it seems to have overtaken its primary specialty, dermatology itself.
How?
So today, the aspiring medical graduate with an MBBS degree looking to postgraduate is looking at dermatology more through the lens of aesthetics. So there are a large number of doctors who've taken up dermatology, and as you probably know, for a while it has been as popular as radiology as a postgraduate specialty, thanks to aesthetics. So today, the number of people doing dermatology for dermatology's sake are few, and I wouldn't say very few, but few, and many of them taking it up for aesthetics. So aesthetics has become the flag bearer for the specialty. So it's a good specialty to be in, but always to remember your roots and the primary specialty itself. Yeah.
Be true to the cause and not just to the fruit.
To the yes.
Fruit, not just fruit antiri.
Not just the fruit.
Amazing, doctor.
Yes.
So continue ನಿಮ್ಮ magical hands and ನಿಮ್ಮ ಜ್ಞಾನದ ಮೂಲಕ keep the world away from all the blemishes, pimple, acne, and then whatnot. Continue to make the people look the world beautiful with beautiful skin. I hope I got that right.
Yes. Thank you so much. It was a pleasure.
Pleasure, doctor. Yes. And of course, ಪ್ರತಿಯೊಬ್ಬರು ನಮ್ಮ ಶೋಗೆ ಬರೋರಿಗೆ we give a gift. That is the book. I don't know what kind of interests you now. I have 2 books for you. Power of Your Subconscious Mind by Dr. Joseph Murphy. ಅಥವಾ ಇನ್ನೊಂದು How to Talk to Anyone by Lee Lowndes. ಯಾವುದು, which title is like interesting ಅಂತ ಅನ್ನಿಸ್ತು?
I think both are wonderful titles. I can go with this one.
Go for it, doctor.
Thank you.
Also on Music Pillow from Repose.
Thank you.
You're welcome, doctor.
I would have been happy with this alone.
No. ಸ್ವಲ್ಪ ಬ್ಯೂಟಿ ಸ್ಲೀಪ್ ನಿಮಗೂ ಸಿಗಲಿ ಥ್ರೂ ದ ಮ್ಯೂಸಿಕ್ ಪಿಲ್ಲೋ. ಆ್ಯಂಡ್ ಒಂದು 2 ನಾಮಿನೇಷನ್ಸ್ ನೀವು ಕೊಡಬೇಕು. ಯಾರನ್ನು ನಾನು ಕರೆಸ್ಬೇಕಿಲ್ಲಿ, ಸೊ ದ್ಯಾಟ್ ವಿ ಕ್ಯಾನ್ ಆಲ್ಸೋ ಹ್ಯಾವ್ ಅ ನೈಸ್ ನಾಲೆಜಬಲ್ ಬ್ಯಾಂಟರ್ ವಿತ್ ದೆಮ್. 2 ನಾಮಿನೇಷನ್ಸ್ ಕಮಿಂಗ್ ಫ್ರಮ್ ಯುವರ್ ಸೈಡ್. ಯಾವುದೇ ಕ್ಷೇತ್ರದವರಾಗಿರ್ಬೋದು. ಯಾರನ್ನ ನಾಮಿನೇಟ್ ಮಾಡ್ತೀರಾ? ಜಸ್ಟ್ ಕ್ಯೂರಿಯಸ್, ಕರ್ಕೊಂಬನ್ನಿ ಅವ್ರನ್ನ ಅಂತ.
Well, you can definitely look at Dr. Devi Shetty.
Interesting suggestion.
Yeah, for this. And somebody from, ideally from, from the chess world, with so many young, I don't know, they're not, most of them don't seem to be Bangalore based. So that would be a challenge.
So somebody from chess.
And somebody from the sports world.
Sports world. And Dr. Devi Shetty is your recommendation.
Yeah, I think, yes.
Thank you, doctor. I hope ಇವತ್ತಿನ episode was interesting enough for you all about dermatology, about pharma, ಮತ್ತೆ ಸ್ಕಿನ್ ಕೇರ್ routines, products and a lot more. And I'm sure ಅವರ ಅವಶ್ಯಕತೆ ಬಿದ್ದಾಗೆಲ್ಲ Dr. Shetty's ಸೊ ನಮ್ಮ ಈ ಕಾನ್ವರ್ಸೇಷನ್ ಯಾವ ಒಂದು ಭಾಗ ನಿಮಗೆ ಭಾಳ ಇಂಟ್ರೆಸ್ಟಿಂಗ್ ಅಂತ ಅನ್ನಿಸ್ತು ಕಮೆಂಟ್ ಸೆಕ್ಷನ್ನ ಮೂಲಕ ತಿಳಿಸಿ. ಅಂಟಿಲ್ ನೆಕ್ಸ್ಟ್ ಟೈಮ್ ಲೈಫಲ್ಲಿ ಕಂಟಿನ್ಯೂ ಟು ಸ್ಟೇ ಕ್ಯೂರಿಯಸ್. ಆ್ಯಂಡ್ ಇವತ್ತಿನ ಒಂದು ವಿಚಾರ, ಚೆನ್ನಾಗಿ ನೀರು ಕುಡೀರಿ, ಚೆನ್ನಾಗಿ ಹಣ್ಣು ತಿನ್ನಿ, ಆ್ಯಂಡ್ ನಾವು ಹೇಳಿದಲ್ಲ ಎಲ್ಲ ವಿಚಾರಗಳು ಅದರ ಅಟ್ಲೀಸ್ಟ್ ಒಂದು 2 ಪಾಲಿಸಿ. ಐ ಥಿಂಕ್ ದಟ್ಸ್ ದ ನೋಟ್ ಫಾರ್ ದ ಡೇ. ಸೊ ಅಂಟಿಲ್ ನೆಕ್ಸ್ಟ್ ಟೈಮ್, ನಾನು ನಿಮ್ಮ ರ್ಯಾಪಿಡ್ ರಾಶ್ಮಿ, ಸೈನಿಂಗ್ ಔಟ್ ಆಫ್ ಜಸ್ಟ್ ಕ್ಯೂರಿಯಸ್. Continue to stay curious in life.